Good afternoon, ladies and gentlemen. Welcome to our international conference on population changes and policy responses in East Asia. My name is Yoon Jung-shin, and I'm a research fellow in Korea Institute for Health and Social Affairs. It is my great honor to be with you in this wonderful international conference. And I hope everybody enjoy our conference and have a meaningful times. Let's begin the opening ceremony. Dr. Tae-Soo, the president of KIHASA, will give us the opening remark. Since he was not able to be with us in person, he sent a video message for us. Let's take a look at it.
Good afternoon. I'm Tae-Soo Lee, President of the Korean Institute for Health and Social Affairs. Welcome to our international conference on population changes and policy responses in East Asia, taking place in the form of webinar. I'd like to thank all of you for your participation. As such conference was not held last year due to COVID, it gives me a particular pleasure to hold this webinar. The Korean Institute for Health and Social Affairs has a long history of researching demographic issues and topics. Our institute was first launched as the National Family Planning Institute back in 1970. And as you may know, Korea was a fertile nation with a high fertility of about 4 back then. Our predecessor, therefore, was founded for the purpose of population planning. Partly due to the impact of COVID last year, however, we're experiencing a globally unprecedented era of low birth rates with a 0.83 fertility. Against this backdrop, Japan experienced a period of low fertility earlier than Korea and has come up with response measures, and other East Asian countries either are undergoing or on the threshold of such a period. This makes me believe that it is quite meaningful for you to take an interest in Korea's various demographic policies. Allow me to thank today's attendees, particularly 6 presenters representing 5 nations. Thank you to Professor Thang Leng Leng of Singapore, Professor Stuart Gietel-Basten of Hong Kong, Professors Pramote, Prasartkul, and Napaphat, Satchanawakul of Thailand, Dr. Toru Suzuki of Japan, and Professor James Chong Tai Shen of Taiwan for your insightful presentations. My thanks also go to our discussant, Professor Terence from the Australian National University, and Professor Sang Lee from East-West Center at University of Hawaii. Let me acknowledge Professor Emeritus Tae-Soo Kim of Hanyang University, the most prominent authority in this field, for serving as moderator. Last but not least, I'd like to acknowledge that Dr. Yoon Jung-shin of our institute has researched demographic issues for a long time and has built an international network, and that researchers Ji-Hae Lee and Ji-Hae Lim are also here with us. And thank you to them for putting a lot of work into putting this event together. I sincerely hope that sharing the 5 countries' experiences will inform our efforts to formulate new policy for Korea's ultra-low fertility and provide implications for other countries through information and sharing. Let me close by wishing today's webinar a resounding success. Thank you.
Okay, very good. And now we move on to the first session. And I would like to introduce the moderator of today, Professor Tae-Soo Kim from Hanyang University, and he will lead our sessions. Professor Kim, you have the floor.
Thank you, Dr. Shin. Good afternoon, everyone. Good evening or good morning, depending on where you are. It gives me a pleasure to serve as moderator today and welcome you all once again to this conference on population changes and policy responses in East Asia. I'm very happy to see old friends and colleagues in good health after a long while. Well, we are all aware that 6 countries or regions of our concern today share lots of common factors in their demographic features and policy responses as well. But each country is different in their geopolitical and socioeconomic setting, and there exist differences in the degree of main focus and priority of policies. It is great to have an opportunity today to learn lessons from the experience of neighboring countries and broaden our perspectives and insights. Today, we are going to have 2 sessions with 20 minutes break in between the sessions. And once again, I would like to ask each speaker to finish his or her presentation within 17 minutes. I noticed that some of the speakers have prepared quite a lot of materials for their presentation. Please bear in mind that each speaker has a 17 minutes limitation. After 3 presentations in each session, an assigned discussion will have about 15 minutes for comments and questions, which will be followed by a Q&A session for about 15 minutes. For those of participants who wish to make comments or ask questions, please use the chatting window function on your monitor. I'll be happy to read as many of the posted questions and comments on your behalf, or depending on time availability, I may call out your names during the Q&A session. And for your information, this conference is going to be videotaped, and after going through some minor editing, it will be uploaded on YouTube on this Thursday or later this week. Well, now we proceed to the first presentation, and our first speaker is Dr. Thang Leng Leng from National University of Singapore. She's an associate professor at the Department of Japanese Studies. She has many publications on intergenerational relations, aging, family, and socio-cultural issues in Singapore and Japan. Currently, she serves as president of the Singapore Gerontological Society. Today, she is going to talk about population and aging policies in Singapore, with foresight on elder care, intergenerational support and bonding, and active aging. Now, please join me in welcoming Professor Thang Leng Leng.
Thank you very much. Thank you very much, Professor Kim, and also my appreciation to KIHASA for this invitation. I'm very honored to have the opportunity to talk about aging issues in Singapore. With the time limit, I will only be focusing on the first focus on elder care. So let me share screen. Yes, can everybody see? Okay, let me show. Okay. All right. Thank you very much. And with 70 minutes, I have to ensure it. Okay. So for the outline, I will be really glad to talk about different aspects, but given the time limit, let me focus on the broader background discussion on long-term care, emphasizing on service provision and informal caregiving, because they are one of the most challenging aspects of aging issues in Singapore, and I believe in your parts of the country as well. So we all know Singapore is such a really tiny country. We are only about 730 square kilometers big. Its population, though, has grown more than double since 1970, with a total population of 5.68 million in 2020. This has made it one of the most densely populated country in the world, with as many as 7,800 persons per square kilometers. Foreign population made up 26% of current population, and resident population made up about 4 million, of which 3.5 million are citizens. Aging of population can be seen from the rise in median age to 41 years old now, which doubled from 1970 at 19.5 years. There is more than 3 times decline in old age support ratio in the period, from 17 persons aged 15 to 64 years to 1 person aged 65 and over, down to over 4.6 persons in 2020. So, for the first time in Singapore's modern history, the population of aged persons aged 65 or above reached the same proportion of 14% with young people under 15 years old in 2018. By 2030, the older population is expected to increase to 27%, while the young population will fall to 10.8%. Some have thus called 2018 as the watershed year, where Singapore's demographic time bomb will start ticking. So we are very familiar with life expectancy as one of the main reasons. Our life expectancy has increased tremendously to 86 years old, especially for women. It's very high. And that's also coupled with a large proportion of baby boomers that are aging. Singapore has a large cohort of baby boomers born between 1947 to 1964, making up about 30% of the population as a whole. The baby boomer generation first entered old age, defined as 65 years and above, in 2012. This is why we are seeing an acceleration in the rate of aging, increasing 6.2% in the mere last 10 years. And Singapore is known for being multicultural, multi-religion society. So with the 3 main ethnic groups here, Chinese making up 2/3 majority of the population, followed by Malay and Indian. As this table shows, we see a further shift of a higher proportion of Chinese among those aged 65 and above. Fertility rate is another widely known reason for rapid aging. And in Singapore, the very successful population planning to urge people to stop at 2 in the 1970s was successful, and this is further maintained with changing socioeconomic situation. Here you can see that by 2020, our TFR was a mere 1.1, and Chinese has the lowest TFR of 0.94 among the main ethnicities. The impact of population change here can be seen with households getting smaller over the years. Average household size today in Singapore is 3.3 persons per household. Among the older residents, as we see in this resident households for age 65 and over, there is quite an increase in 1 person and couple-owning households. And this brings concerns to long-term care provisions for aging in place. also, we all know that one of the fast emerging issues with aging society is dementia prevalence with higher life expectancy. And this has led to greater efforts recently to promote awareness on dementia in Singapore and to build a dementia-friendly environment. Now, what is the response to Singapore's policy response in Singapore? I think there are a few characteristics that we can highlight here. First is, in fact, if we look back, there has been quite a long-term strategic approach to it, and also a whole of government approach, as we've seen from major national level committees that built along from the beginning, from the first one that was set up in 1982, which was called the National Committee on the Problems of Aging. And then there are subsequent committees that built, in fact, from the first recommendations from the first committee. So as current as the 2015 Action Plan for Successful Aging, which got us excited because of the budget, big budget, with an aim of building a nation for all ages. It also, in fact, we can see the recommendations that was coming even from the first 1982 committee. And second characteristics we can see here in Singapore is really this big shift from aging as problem focus to that as the vision of successful aging, the more positive gerontology approach that has been taken in the recent decades. In terms of concepts of the characterizing aging society, we can see that there is this many helping hands approach with first with individual responsibility to plan and prepare for old age, and then family will be the first line of care, community as a second line of support to enable families in the caregiving role, where the role of state has largely been facilitative and residual to support volunteering and private sectors by contributing infrastructure and institutional resources. Although in the recent years, there has been much more proactive efforts, such as to set up government-run nursing home. And of course, the government also serves as a social net to those who have no family support, to provide financial assistance for an array of support together with the volunteer organizations. Here, the community is construed in a form of ethnic-based, religious and secular non-profit volunteer welfare organizations we call VWOs. There are more than 450 VWOs with about 150 of them in the aging and disability service. Well, although it's, expectations, especially in Asian society, for children to care and support for older parents, in part rationalized through the traditional norms of filial responsibilities. Scholars like Rosario and Rossetti here note the uniqueness of Singapore in this aspect, especially the Singapore government with explicit upholding of the ideal of familial support for their elderly relatives, especially in provision of long-term care services. A glimpse on long-term care support affirms the norm for familial support, as a national survey on informal caregiving of older persons 75 years and older show adult children comprises 77.5% of all caregivers. And of course, increasingly there is concern that with the realities of population and social changes, how long can Singapore families hold on to this tenet that family is the first line of support? So the other significant framework of aging is aging in place, a concept that most of us here should be very familiar with. Now, when we talk about needing access to long-term care, quite often there's concern that there's confusion that where to go with so many services and array of social agencies that are involved. So in Singapore, as early as SEP 2001, there is a centralized intermediate and long-term care coordinating body that's set up to help navigate the diverse services available and to better coordinate care needs. So this is the Agency of Integrated Care. And here in this website of the AIC, we see that financing is one key challenge of long-term care. The effort to address this with a new national long-term care insurance scheme that just started called CareShield Life to replace the currently less adequate ElderShield insurance. So with CareShield Life, it has become compulsory for all residents to enroll from 30 years old and pay annual premium until the age of 67. But there is still much concerns with affordability. Although there is financial assistance from the state for lower income families, long-term care can be a huge strain for middle-class families. This is a whole list of programs, long-term care services that's available, which has expanded quite a bit in the past 10 years, where we can see a lot more of home care services that's available and community care services, parallel with the approach for aging in place. There's also nursing homes here and you can see here that nursing homes, the numbers have increased, showing the rising need for institutional care as well. In a news article, while the Senior Minister of State for Health reported that between 2016 to 2020, 8 new nursing homes were set up, he also stressed the importance of caring for older persons in the community as far as possible, and to quote, make sure that we don't entrench our elderly in institutions as they age, unquote. This shows that for the state, the question of balancing nursing home provision with family support has been a delicate one. On the one hand, there is reluctance to make nursing home easily available for fear that it would become a first resort it becomes a first resort of discouraging family members to take up the responsibility of family support for the old. But on the other hand, it is critical to provide appropriate facilities to care for chronically and terminally ill. But with diminishing capability in smaller families where couples may have to care for as many as 2 sets of older parents while working and child rearing, availability of nursing homes within close proximity to residential housing will help to ensure proper care and easy connections. And recently, I noticed a shift in perceptions on nursing home admissions. Instead of viewing nursing homes as last destination of life, older persons are encouraged to return back home as health conditions improved. This is the data showing that there has been a substantial increase for both daycares, day center, and home care places. This is taken from a report from Lien Foundation on long-term care of older persons in Singapore in 2018. And these are figures only from VWOs and nonprofit services. Although they largely dominate aging and care landscape, there have also been a rapid increase in private care providers in the recent years. There are at least 60 of them, with most of them offering home care. And over time, we also see plenty of new care models that are coming on to provide integrated care programs. So, for example, this is Singapore program for integrated care of elderly called SPICE, which is one such program of integrated home and center-based program model after the US-based program for all-inclusive care of the elderly, incorporating primary and specialty medical care multidisciplinary teams in a single care program. Then the other example is a new care model called Care Close to Home program that was just piloted in 2014 by Temasek Foundation Cares and the AIC in support of vulnerable seniors with low or no caregiving support. So this one provides a care team concept of a care manager, healthcare aide, and social worker to be placed in the residential communities. And more recently, in early 2021, there is a new option of integrated care and housing explored through the introduction of community care apartments by the Housing Development Board, where the pilot project has about 160 units integrating senior-friendly housing with care services that aims to provide assisted living to enable older persons who are 65 years and older with some care needs to continue to live in the community independently. In terms of care, especially aging in place, informal care support and availability and support of it becomes very important over time. So we have seen an increasing attention on issues that's faced by caregivers of older persons requiring long-term care in Singapore. And this is especially so when it's very common for the women to be staying in the workforce in Singapore. In 2018, among the female residents aged 40 to 59, it has been shown that 20% for those that are out of the workforce, 20% had to care for family members other than children. So with this, in 2019, we see a care support action plan that was rolled out by the Ministry of Health in trying to address the issues that are faced by the caregivers. So among the programs, I just want to bring to your attention, especially the financial support side, where it talks about caregivers training grant given to equip caregivers with skills, and then also to have foreign domestic workers concessionary levy rate, as well as caregiving grant to defray caregiving expenses, such as to replace the current FDW grant. So the mention of FDW, foreign domestic workers, in fact shows that to enable aging in place to be cared for at home. In fact, in Singapore, it's common for families to rely on the employment of foreign domestic workers. So they are very much entrenched in the system. And with that, when we talk about manpower challenges in long-term care, really there will be challenges in terms of increasing demand for foreign domestic workers as caregivers at home. And they're expected to increase over time. Recently with COVID, there has been a restriction of foreign domestic caregivers coming into Singapore to work. So this has been a big issue. And then we are also estimating, 130% increase in long-term care manpower need by 2030, which is our long-term care setting, 70% of the employers are foreign workers compared to a very high percentage compared to many other countries. So in conclusion, I'll just like to bring to our attention of when we talk about aging future, there's really a lot of needs for innovation and rethinking in terms of family. If family is going to be still important, and it will be, then what kind of policy innovations we need to work for in housing types and care options, transport, and so on. And we will also be seeing, as part of innovation, much more integration in terms of innovative hubs, co-locations, co-services, and the kind of flexibility. And also in technology, it's going to play a very main role of coming on with technological solutions. In Singapore is that of, we have the Smart Nation initiatives to include care initiatives for elderly care. So I just like to close with a picture of St. Joseph Home in Singapore. It's a nursing home, and in its recent redevelopment, it has also started to bring in childcare center, becoming an integrated facility, and including, very exciting features of intergenerational playground in nursing home. We're going to see more of this in the future, I'm sure. Thank you very much.
Thank you, Leng Leng. I think it was an excellent review of the key features of aging policies in Singapore. I like your conclusion highlighting family integration and technology, which require more innovative inputs in the course of aging development. One question that I have about Singapore welfare system is that how the multi-ethnic nature of the society with a large number of foreign workers has affected the shape of welfare system. I remain curious how the Singaporean government manages to cope with the issues of inequality, discrimination, and so on. So I would appreciate if you say a few words about it during the discussion session. Okay?
Yes, thank you.
Why don't you proceed to the second presentation now? Our next speaker is Professor Stuart Gietel-Basten from Hong Kong University of Science and Technology. He is director of the University Center for Aging Science. After getting his PhD from University of Cambridge in the year 2008, he has been very active in the international circle. His research covers the interplay between changing population dynamics and social policy in East Asia. The title of his presentation today is Income Protection in Old Age in Hong Kong. Stuart, please go ahead. You will have to unmute your microphone.
Okay, I'll be the one person who makes that mistake today. Right, now it's out of the way, right? So, well, thank you very much, Professor Kim. Thank you very much to KIHASA for inviting me today, and it's great to see everybody today. So yes, I'll be talking. So we're a little bit bigger than Singapore, not much bigger. We're about 1,000 square kilometers. So we're getting bigger as the day goes on. So I'm going to be presenting on this issue of income protection in older age in Hong Kong. Now, of course, there is a paper attached to this presentation. That is a lot more goes more in depth on particular on the different provisions which are there into criteria, conditions, numbers and rates and so on. But I didn't think that I'm not going to present those today because I think that there's no need for us to get into the granular data, I think, here. It's really more about the principles and the outlines and the implications for Hong Kong and demographic change, but then also what we may be able to learn from Hong Kong and share with other parts of the world. So, of course, sure you'll be familiar with this kind of World Bank multi-pillar taxonomy of income protection systems. So the 5 pillars of protection with different target groups, different criteria, and so on. And so what I will start off by doing is just to kind of go through quickly each of these in turn, just to give you like the landscape of income protection for older persons in Hong Kong. So in terms of Pillar 0, we do have a universal old age allowance, but it's not a lot of money. You get about €5 a day, which in Hong Kong is not going to get you very far in many places, and it really doesn't get you very far in Hong Kong, where life is pretty expensive. And so this is popularly referred to as fruit money, because really, once you've bought your fruit, there's not much else you can do with the OAA. Then there are some other means-tested allowances, so the older age living allowance, where you get a little bit more, about €400 a month. We also have something called the Guangdong Fujian scheme, which means that you can take your various different allowances and they're portable. So you can move to Guangdong province and Fujian province and take your allowances with you. But the kicker is if you have public housing, you have to give that up. So that's not a very popular option for many people. And not only are they means tested, but they're also based on asset thresholds. And this is something I come back to a few times. Is that in Hong Kong, of course, not only when we're thinking about cash assets, but also when we have extremely expensive housing as well, how we factor in measuring these property assets and other kind of intangible assets as well. This is very simple. Pillar 1 is very simple to discuss. because we don't have a publicly funded pension system. So that's it. There is nothing more to say on Pillar 1. Pillar 2 is our kind of main income protection mechanism for the older population is our mandatory provident fund, and is our MPF, and this is, as the name implies, a mandatory fund where, as long as you meet certain basic conditions, you have to put in around 5% of your income, and then your employer would also have to make a kind of a matching input as well. Now, MPFs are very good in many ways because, of course, they don't cost the government any money, but they're also problematic as well, in the sense that they have a relatively high expense ratio and also variable return on your investment as well. So that requires a certain amount of kind of financial savviness or financial literacy to really make the most out of your MPF and of course managing risk and the potential damage of economic shocks and turn downs. In terms of Pillar 3, which is a kind of individual non-mandatory or voluntary savings plans, obviously we have a very highly developed financial sector in Hong Kong. We also, and so many different products for voluntary savings plans, long-term annuities, long-term insurance products in particular. But then also, more recently, a lot more discussion about reverse mortgages to brighten up your retired life. And so these are all consolidated under one corporation, the Hong Kong Mortgage Corporation. And like any other mortgage, you can either have a floating rate or a fixed rate. You've got to be over 55. But the take-up for these is not particularly high. It's only about just over 3,000 households in Hong Kong have a reverse mortgage at the moment. And actually, the rules are changing all the time. You can actually stay in your apartment now, or you can rent things out as well or you can rent them out while you're taking reverse mortgage. I should say actually that for the numbers before, the policy address was a couple of weeks ago, and so those numbers are probably a little bit different. They've actually changed. So I'm sorry, I didn't update those after the policy address. Now, in terms of Pillar 4, so then that's kind of everything else, which may not be directly income supporting, but kind of supporting or offsetting income, offsetting expenditure. We have universal healthcare in Hong Kong, although long-term care, chronic care is a little bit more problematic. We have public housing in Hong Kong, a large percentage of the population living in public housing, and there are new schemes coming online. So very similar in many ways to what was discussed by Professor Tang in Singapore. So new schemes through the public housing modality. Various other different public programs, such as the senior citizen card, the $2 schemes, so subsidised transport, and of course the role of family support and migrant domestic workers is a big part of that. So in terms of demographic systems and prospects, well, again, we're very similar to Singapore in this sense. So Hong Kong and Singapore are always fighting over, our city-state status, and we're fighting for the lowest fertility rate in the world. We're going to be fighting for the longest life expectancy in the world. Our government forecasts for TFR are that they are flatlining, that we're going to have a TFR of around 1 for the foreseeable future. This is different to the UN model, which suggests that there'll be a gradual increase. And similarly for in terms of life expectancy, we're forecasting a constant increase. This is life expectancy at the age of 60 from government numbers, and of course, for males going from maybe 21 years 20 years ago up to 28 years by the 2060s. So we are on that path to very rapid aging, and here we can just see a very simple distribution of the population. And we are, again, the same with Singapore, going to see a very rapid increase in that older population. So what are the implications of that? What are the future prospects? Well, as you probably kind of gathered so far, compared to other countries which have very big, highly developed, very expensive pension systems and long-term care systems and chronic care systems and other social welfare apparatus, our rather poor, meagre approach means that in terms of public financing, we're probably going to be okay. Because we have these relatively cheap systems which are quite resilient to population aging. Furthermore, of course, we could think about what we call demographic metabolism. So our population is getting older, yes, but it's also characterized by very high levels of education, very high levels of skills, higher incomes, and improving health. So when we think about, well, what is the point of this, right? What going beyond public financing? Inevitably, we have to think about poverty alleviation. Why do we bother with income protection in the first place? A big part of this is going to be poverty alleviation, and the government makes many graphs like this to really emphasize the impact, the significant impact that these different income protection measures, particularly the tier zero, the pillar zero measures, have made for pushing down poverty in Hong Kong now. And these are based upon very theoretical assumptions. However, I think we can say that still our poverty levels in Hong Kong are too high, particularly when you consider we're one of the richest places on the earth, on the face of the earth. Our poverty levels at older ages are still high. But again, this comes back to this challenge of defining and measuring poverty. So in Hong Kong, poverty is measured at 50% of the median income. And as I said before, if we're dealing with other assets and things like houses, then you can have people who are going to be in poverty but living in a multi-million-dollar house based only on income. So that's why one of the things that is urgently needed in Hong Kong, I think, is really a much more in-depth, comprehensive, systematic review of poverty and thinking about poverty in a much more multi-dimensional way. And of course, for any of you who've been to Hong Kong, you will see and understand that poverty really is, the older poverty is very much in your face, right? You can see it, whether or not this is for what are kind of rather inaffectionately called cardboard grannies, so older people going around collecting cardboard and other small recyclables. We have clearly have a very big problem with what we call cage housing or subdivided housing. Very, very poor living conditions. So there's clearly a lot of people who are not covered and who are struggling under these circumstances. But again, we need to understand better, I think, well, what is the situation? What is the motivation? Is it uniformly bad? Is it people who are working to death? Or is this what is, this is just kind of social capital and active aging and productive aging? It doesn't look like it to me, but is it? Is it about refusing to take handouts, right? Is it actually about dignity and the choice to work rather in work which may at first glance may not see particularly appealing versus claiming allowances? So how are we going to fix this in the medium term? Are we going to have a universal pension? Probably not. There was a discussion about this some time ago, and this really went nowhere. The universal pension is not the Hong Kong spirit. It's kind of laissez-faire, hyper-capitalist spirit. Furthermore, our surplus has now switched into a deficit. For a long time, Hong Kong, of course, had a surplus public finances, but now with COVID and other circumstances, that's gone south. So probably we're more likely to see a more ad hoc future of new little schemes and systems like these I put on the screen here. So new training schemes, employment schemes, pilot schemes on residential care, and so on. And then finally, to consider kind of further demographic challenges. There's, I think, a hope that many people will retire across the Greater Bay Area to Guangdong and Fujian province. But this is perhaps becoming less appealing over time as the gap in the cost of living narrows, and also cohort effect. Fewer people are actually born in the mainland. The same as Professor Tang discussed for Singapore. We have our care system is almost solely reliant on migrant domestic workers. And so that can become very fragile if there is a break in that migration chain. The signing of a document in another country can completely alter migrant flows and really put a spanner in the works for our care system. And then also, of course, I'm sure you're aware, many people are leaving Hong Kong at the moment. There is an emigration wave, and we don't know about the long-term consequences of that and how, both in terms of the quantity of people, but then also in terms of demographic change, financing, and care roles. Of course, the family is modernizing, and this will continue to change, and this will have an impact on care and intergenerational residence, particularly for female caregivers. And of course, in terms of childlessness, we have one of the highest childlessness rates in the world. So that's going to present its own, I think, unique challenges when we are moving into when these childless cohorts moving into older age. So to kind of conclude, so Hong Kong is a little bit, I think, different in terms of our story of aging, in that we have relatively low levels of provision, but that means that we are relatively sustainable in terms of public financing. These policies appear effective at poverty alleviation, but these are reliant on some measures which really need to be rethought, and there's still many, many people left behind. And so while we're getting older, and our public finances seem to be able to cope with that, and through the process of demographic metabolism, we should be okay. There's still some storm clouds on the horizon, and it's certainly not an entirely unproblematic future ahead. Thank you very much.
Thank you, Stuart. It was a very superb presentation on income protection programs for the elderly in Hong Kong. About a couple of weeks ago, I had a chance to read a very interesting article published on Peanuts, and Stuart was the second author. The major argument of the article was that strong human capital accumulation, especially among young cohorts, may offset the projected burdens on social welfare system, and thus lead to more optimistic social and economic future. Whether this will be the case may have profound impact and consequences. And Stuart, perhaps you may want to explain a bit more about this argument during the discussion session. Would that be okay? We now move on to the next presentation on Thailand. We have two speakers for the paper, Professor Pramote Prasartkul and Dr. Napaphat Satchanawakul, forgive me my terrible pronunciation, both from the Institute for Population and Social Research at Mahidol University, Thailand. Professor Prasartkul is Emeritus Professor and renowned authority on population aging in Thailand. Dr. Satchanawakul received his PhD in public policy from King's College London and now serves as the lecturer at the IPSR. The presentation is going to be made by both authors, and I just heard that Professor Prasartkul comes first. The title of presentation is Policy Responses to Rapid Population Aging in Thailand. Please join me in welcoming Professor Prasartkul.
Professor Kim, Professor Hall, and all speakers, it is my great pleasure to be with you on this online panel of the conference. First of all, before our presentation, I would like to thank KIHASA for inviting us to join this project, addressing regional imperatives and challenges on population aging. Our presentation will follow this outline. I will start our presentation by summarizing the situation of population aging in Thailand. After that, Dr. Napaphat, who is new gen at IPSR, will present policy responses to population aging in Thailand and ending with the future challenges. I want to show this slide, which is the covers of the annual reports of the situation of the Thai older persons, which IPSR at Mahidol University and the Foundation of Thai Gerontology Research and Development Institute, TGRI, work together for the National Committee for Older Persons to present to the Cabinet on the annual basis. I have been editor-in-chief of this report for 8 years now, and we are working for a new report of 2021. In 2020, ASEAN has already become an aged society, with the number of population 60 years and over was about 73 million, accounting for 11% of the total population of 664 million. In the ASEAN community, Singapore is the leading country in population aging, followed by Thailand, Vietnam, Malaysia, Myanmar, and Brunei. Only 3 countries in ASEAN, the Philippines, Cambodia, and Laos PDR, whose population 60 years and over are still below 10%. The age structure of the Thai population, shown by the population pyramid, has been changing tremendously. It has been changing from a young population to an old population. The Thai population pyramid 50 years ago looked like an Egyptian pyramid, but now it's not a triangular shape anymore. I don't know what it looked like, but maybe it's similar to a not blooming lotus flower. In 2020, the total population of Thailand, not including migrant workers from neighboring countries, is 66.5 million, with 12 million or 18% are older persons aged 60 years and over. From the population projection of the Office of the National Economics and Social Development Council, NESDC, Thailand will become a complete aged society in 2022 or next year. According to this projection, Thailand will become a super aged society when the population age 65 plus is more than 20% in about 10 years from now. Actually, the population aging in Thailand is not exciting, but the speed of aging is. The population aging is just a common global phenomenon occurring in almost every country in the world. Data from the UN World Population Prospects show that Western countries took at least 45 years for the share of population age 65 plus to increase from 7 to 14%. But Thailand and also Singapore take only 17 years. The Thai population has been aging so rapidly, mainly due to the fast decline in fertility. Nowadays, I try to send an urgent message to the Thai people to watch out the population tsunami that is moving closer and closer to the shore of the Andaman. What is the population tsunami? From the statistic of birth legislation of the Ministry of Interior, we found that during the 20-year period from 1963 to 1983, there were more than 1 million births registered in each year. At that time, the average number of children per woman throughout her child-bearing period, or the total fertility rate of Thai women, was as high as 4 to 5 children per woman. I'd like to note that in 1971, there were 1.2 million births registered, which was the peak number of yearly births in the Thai history. Last year, in 2020, only 580,000 births registered, which is less than half of the peak year. The average number of children, or the TFR, of Thai women this year was only 1.2 per woman. I call those people born during this 20-year period a million birth cohort. Someone may call it baby boomers of Thailand, but sometimes I call it population tsunami of Thailand. It is projected that in 20 years from now, the population 60 years and over to increase from 12 million to 21 million, or increase at the average rate of 5.6% per year. Now, Dr. Napaphat is presenting how Thailand has been responding to this rapid population aging. Dr. Napaphat, it's over to you.
Thank you, Professor Pramote Prasartkul, for giving an overview. So now I would just like to give a background of the policy response to the rapid population aging in Thailand. So in response to population aging, Thailand has long been cultivated the policies on aging in line with the international policy framework since the early 1980s, like you can hear from Singapore as well in the 1982. However, the role of the state was quite limited at the time during the first long-term plan. During the late 1990s to the early 2000s, Thailand tried to reframe its policy framework and related plans in response to population aging. They were influenced by both the promulgation of the new constitution at the time in 1997 and also the adoption of the MIPA, the Margaret International Plan of Action on Aging, in 2002. But subsequently, Thailand enacted the first Act on Older Persons in 2003, which certifies the rights of Thai older persons. Since then, population aging has been included more explicitly in the national agendas over the last 2 decades. But during the last 7 years, under the premiership of General Prayut Chan-o-cha, the current Prime Minister, we have seen some progress about the direction of aging policy in Thailand. For example, if you can see from the slide, in 2016, the cabinet just passed a resolution to issue the 4 measures to support aging society, which consists of the issues of income security, pension funds, housing, and also reverse mortgage, as happened in Hong Kong as well. Likewise, in 2018, the government has also issued driving measures of the national agenda on aging society in line with the 20-year national strategy, which shall be implemented accordingly. This is the overall policy response. The first policy domain that we would just like to discuss here is the income security policy. This policy domain in Thailand is a mixed but fragmented system. It is designed for those who are both in the formal and also in the informal sector. But of course, about 80% of Thai older persons are in the informal sector. However, it is a fragmented system because there's no central agency at the national level to govern the entire pension system at the moment. For those who are in the informal sector, Thailand has universalized the old age allowance program since 2007 to pay monthly allowance about 600 baht to 1,000 baht, about 20 USD per month, to about 10 million older persons who are ineligible to receive other forms of pensions from the state. If you can see from this slide, you can see the unequal distribution of state income security for Thai older persons. The government spent about 267 billion baht for less than 1 million retired civil servants versus 76 billion baht for almost 10 million ordinary older persons. It's about 4 times difference. It's quite large for the unequal distribution of this. Even though the universal coverage of the old age allowance or OAA contributes substantially to the public expenditure for the Thai government, but these amounts are still reported insufficient to sustain a minimum standard of living in Thailand at the moment. Apart from the social protection, the income security that I just mentioned, the Thai government in 2016 under the Prayut government also initiated a measure, the so-called State Welfare Card Program, to provide specific assistance, for example, to provide the monthly limit credit to purchase consumer products for utility bills, for example, for the low-income population. From the number last year in 2020, there were about 14 million beneficiaries of the cards, and about 5 million of this number are older persons. This means that about 40%, 39% exactly, of Thai older persons are seen now low income. This is a very huge challenge for the Thai society, Thai aging society. Next, about regarding the healthcare policy, I suppose that you have heard about the universal health coverage in Thailand. Thailand is quite progressive in this policy domain, I suppose. We have introduced and achieved the universal health coverage since 2002. Public health service under the insurance rate schemes for all Thais, including older persons. Although there are some, is it post? Okay. Although there are some different conditions and benefits package between the 3 schemes, but most Thai older persons, about 80%, they have access to the public health service through the Universal Coverage Scheme or the UCS. Apart from healthcare policy within healthcare, actually, the government also launched a long-term care system in 2016, 5 years ago. However, it is quite limited to those who are dependent, either bedbound or homebound, for example. A key strategy of Thailand long-term care systems, it calls for an integration of healthcare and social care service system at a community level. I suppose that we try to use the strength of Thai society, which is the family and the community as much as possible, apart from the Bangkok metropolitan area. In 2019, we have seen that there will be like 76% of the local administrative organization or LAO participate as the long-term care providers. Although the participation from the LAO is quite high, the long-term care system in Thailand is still in its infancy, in early stage, and needs further adjustments for smooth implementation in the coming years to come. Moreover, in the third policy sector that we would just like to discuss here, it's about social service policy. Thailand has provided other types of social service for its older population. For example, for housing, there are 2 main approaches of state policy in housing an aging population. The first one is we encourage our older persons to age in place, like in Singapore, as long as possible at a community level, while the second is to promote institutional-based living. But, the overall direction of the policy is not quite clear at the moment. I will go on further. At the moment, there are about 27 state fund residence specifically for low-income older persons. But each center accommodates only about 150 or 200 persons per center, which is very small compared to the number of low-income older persons across the country. Recently, in 2019-2020, last year, there were attempts by the government to build the senior complex for older persons by the cooperation between the medical school and the treasury department under the Ministry of Finance. But nevertheless, its target group focused mainly on older persons with middle income and above. Regarding education, we have different platforms to encourage the participation of older persons. For example, the community centers, the clubs, the schools for older persons. Nevertheless, these mechanisms are still highly centralized. It's not managed by the local government organizations. Regarding personal social service, I would like to take the importance of the volunteers. Thailand has a variety of volunteers. We have got many versions of volunteers. Each ministry has its own volunteers. For example, the Ministry of Public Health, they have their own volunteers, more than 1 million persons. The Ministry of Social and Development and Human Security, they have their own volunteers with expertise in elder care, about 25,000, something like that. However, such volunteers and caregivers shall be paid with attractive rates based on the local decisions in different areas, so that the long-term care system can be performed with more consistency. Because nowadays it seems that they are not paid fully, they are not working full-time. Finally, we would just like to conclude the presentation by giving the policy implications for the future challenges. First of all, the government should implement long-term care policies by applying the concept of aging in place, rather than opting to fund or invest in institutional-based living that sounds against the fiscal capacity of the Thai state. Secondly, the community-based integrated service should be even more strengthened to support the concept of aging in place, but we can only do so by fully decentralizing the government functions and resources to the local entities. Thirdly, when we talk about population aging, Ajahn Pramote or Professor Pramote always says that it's not an issue for the current older person because it might be a bit too late to respond to. Thailand will not be able to survive what Ajahn Pramote called population tsunami if the younger generations are unable to start preparing themselves today to become active and healthy persons in the future. Finally, the overall direction of Thailand's policy response to population aging has shifted from a charity-based to the rights-based approach already. However, the pendulum, it's now taken again by an attempt from the government to curb its expenditure by using the target-based approach to provide the old age allowance only for the low-income older person. But of course, it would be very difficult and costly for any government who try to revoke or change its policy direction. And yes, that's all. Thank you very much again for your attention, and we hope that you have a clear picture towards the policy response in Thailand now. Thank you very much. Over to you.
Thank you very much for being punctual and also for your excellent review of welfare policies. I like your summary of the 4 challenges of what you call PDFE appeared on your last slide. Well, I just noticed that Dr. Satchanawakul has worked on the impact of COVID-19 recently. It would be great if you say a few words about the possible short-term impact of COVID-19 on the implementation of the formal and informal welfare programs for the elderly during the discussion session, if you could. Well, now I'm happy to invite Professor Terry Hall for comment and questions. He is an Emeritus Professor in the School of Demography at the Australian National University and is also a Fellow of the Australian Academy of Social Science. He is an international scholar of repute and has a wide experience in providing population policy consultations to the government of Indonesia, Myanmar, and many other Asian countries. He also served as the president of the Asian Population Association from 2013 to 2015. Now, please welcome Professor Hall. Please unmute yourself.
Seeing my audio now.
Yep.
There it is. I hope that the sound is okay. I'd like to thank all three presenters for keeping to time and also for presenting a very deep overview of aging in the three countries that we've seen today. The countries, let me just, the three countries, of course, are two countries and which are city-states, and they are three unique cultural settings and give us an opportunity to contrast how culture impacts institutions in all three. The papers, and Stuart has already indicated that we really need to look at the full paper to get a good understanding of the situation in Hong Kong. The three papers are quite substantial, and I think that they will make a great presentation in the final publication that KIHASA will be bringing about. The contrast of Singapore and Hong Kong attracted me most because of the city-state status of these two areas. It's already been discussed by both authors that we have contrasting dynamics of the pace of aging. Singapore is 15% over age 65 right now, Hong Kong about 12%. And that reflects to some degree issues of migration in the two areas. Strains in both of the areas are, on the one hand, Singapore with families under pressure. And what really struck me was Hong Kong with empty families. Stuart mentioned that 34% of the women at age 50 were childless. I think that the issue of childlessness is one that all three countries needs to look at and take a good analysis as to the degree to which this is voluntary childlessness, the degree to which that decision to remain childless is determined by the institutions of the state, which create a situation where it does not make sense for individuals to rationally decide to have children. There's a number of speculations that I really enjoyed. One speculation is the contrast between the cardboard grannies of Hong Kong and the cyber grannies of Singapore. And I'm sure that in Thailand, there's a lot of quite hard-working grannies who are out on the streets every day preparing food. Because the one thing that you know for sure is the people who are working in the food stalls are very often over the age of 60. The highly contrasting social support mechanisms in these areas are in terms of expectations versus practice. I was reading in the papers that there are many expectations in the regulations, and I'm not sure that they are always reflected in the practice on the street. Stuart really brought the point home with the images of poverty that Hong Kong is known for. But we also know that there's a lot of poverty in Thailand as well, and that there is poverty also hidden around Singapore. The issues of inequality are things that we need to keep our eyes on. There's very different migration patterns in the three papers. We see that the migration impacts on population characteristics, but it also becomes a crutch for economic development, and it is often put in terms of changing ethnic structures in all three places. And I think that that is something that many readers will be wanting more information about. I think of Thailand in terms of the huge ethnic differentials across the country and what that might mean for aging. Aging in place only has meaning if you have a place. And some of the people have moved out of their real place, and they are not going to be able to age in the target migration destination. I think we need to move beyond the projections. The papers either use the UN population projections or the national population projections. And one comment that I would make is that in the past 4 decades, international statistical agencies have struggled to promote, keeps flipping ahead, struggled to promote more nuanced understandings of projections. We have the tyranny of median variance in projections. We have to train policymakers to understand the difference between a projection and a forecast. We're hearing a lot about this sort of thing this week as world leaders gather in Glasgow to discuss issues of climate change. Forecasts in climate change and projections of population really need a lot more nuance than they are bringing to their conference. We have to have better understandings of the assumptions underlying these projections and forecasts. I was struck by the quite remarkable total fertility rates in Singapore, Hong Kong, and Thailand. Thailand's total fertility rate of 1.2 is just 1.1 of a child greater than Singapore. That's remarkable on a nationwide basis. We need to look at some of the new innovations on probabilistic methodologies. And we got to somehow get away from the dependence we have on dependency rates. Dependency is not a very homogeneous concept in the aging process. I know many aging people, myself included, who don't really feel dependent on a lot of others. And I also know that there's a lot of dependency among the young people who are getting education and searching for partners and residences in the future, and they really need help. The idea that elderly dependency is to be given higher priority than a youth dependency or child dependency is something that I think a lot of people would struggle with. These three case studies really give us the opportunity to learn from each other. Singapore's experience stresses the family as a key element of old age support. And it reminds us of the debates from the 1980s in Singapore about Asian values. And Prime Minister at that time, Lee Kuan Yew, talked in great length about how Asian families were different from Western families. But today, we're probably going to be looking at a much different concept as to the type of value systems that underlie all countries' approach to aging. The Hong Kong concentration on issues of poverty and institutions of productivity and public pension schemes or lack thereof is something that I think every country has to deal with. Indonesia, Philippines, Malaysia are countries that would learn much from the discussions in the three papers we have here. Thailand is juggling a whole range of state-organized institutions. They promise care, but they struggle to guarantee funding. I mentioned earlier about Thailand that in a period of political disruption, it's remarkable how the institutions have evolved rather steadily. And that's something that we need to understand. How does that occur? Where are the drivers of the ideas about institutions for aging in Thailand? And all three of the cases looked at community and volunteer services. I think that that's one thing we need to put some demography around. The community and the volunteer services, we have to understand in terms of who they are. In Australia, we find that most of the care for aged people comes from aged people themselves. It comes from family members who are also aged. It comes from friends and neighbors and older caregivers. So I think that the community volunteer aspect of aging is something we really need to look at. But there are pending questions. How reliable are the national statistical figures for current levels of population by age, sex, and residence? I've been exchanging some chat with Professor Pramote about the Thai census. It's been put off because of COVID. The census of Indonesia was undermined by COVID. I'm sure that the data that we see in Singapore and in Hong Kong has been affected by COVID. And we really need to look carefully about the validity and the reliability of these national statistical figures. I mentioned earlier about childlessness. What does childlessness portend for women's and men's labor force participation into the future? We look at the case of Hong Kong, and the labor force participation of older residents is likely to continue rising. What will this imply for the nature of services provided by older people for all people in the economy? In Australia, for sure, grandparents are relied upon for childcare. I'm sure that similar is the case. It can be found in Hong Kong, Singapore, and in Thailand. If age dependency rises to high levels, what implications will that have for all levels of education systems? With a high proportion of people who are elderly, we really want to have young people, even though they are a small proportion of the population, to be given education that will prepare them. As Thailand pointed out, we need to educate the young for aging in the future. These were three really solid papers, and I look forward to the discussion with the authors. Perhaps demographers, though, should look more closely at the toolkits used by climate scientists and business schools. Scenarios are used to provide speculative stories that may be more convincing in discussions with policymakers and planners. These are ideas where you say, what are the likely trends in the future, and how do we create a narrative about those trends so that people will understand the nature of the decision-making we face. This is not science fiction. This is actually science faction. We want to deal with real facts into the future, but we want to have description as to what Hong Kong is going to be like in 2050 as a place. What will be the situation of Thailand as it is developing in future? We need to narrate these different futures over medium terms and critically assess the drivers of change. At the level of city-states, the dynamics of migration are very strong drivers, but they're not the only ones. The policies for an aging population are likely to be driven also by reproduction, education, and finance trends. And climate change is likely to change everything we currently assume about population trends. I remember standing on the south coast of Thailand and looking out at inundated telephone poles where the sea level has risen already to overtake many previous roads and areas where there were population. If the Glasgow summit goes as badly as it seems to be going, we may be needing some very extreme scenarios to deal with the question of what are the likely futures for our children and grandchildren as they age into disaster. Thank you.
Thank you, Terry. I agree with you that particularly in Singapore and Hong Kong, we need to pay more attention to the dynamics of migration in the design and implementation of welfare policies. Also, he raised very important, huge questions, great questions on slide number 7, but I'm not sure whether anybody can give great answers to these questions in a short period of time. Actually, I was about to take few more questions and comments from the chatting window, but I don't see any at the moment. So let me take advantage of the sitting arrangement, having Dr. Shin just sitting next to me. I may ask her to make a comment or questions, but it should be short. Okay?
Okay. Hello. I'm the project manager for this project, and I really appreciate your very informative presentation and comment. And I have a very short question. for the Professor Leng Leng Thang from Singapore. And Professor Terry Hall already mentioned in his comment about the family in Singapore. And Professor Terry said that the Asian value of the family was changed, and the family in Singapore could be very similar to the Western type of family. And I have the same opinion. And Professor Leng Leng Thang said that the family is the first line of support for the care of elderly. But I think it would not be to take care of the elderly parents because the grown-up children do not live with their parents, older parents, and more women are working in the labor market. So I have a question. How is it possible for Singaporeans to take care of the elderly parents and they do agree with the government plan for the families, the first line of the support? And I have the second question for Stuart. And you said that Hong Kong does not have a pension system. And I think it seems that the aging population of Hong Kong would not be significantly affect the social security budget because they don't have any public pension system. But in your picture, I saw that there are many poor elderly people in Hong Kong. But in your presentation, you said that the government report of Hong Kong said that the income support program like OARA and CSSA have effective to reduce the poverty of Hong Kong. And do you really think that income support program really reduced the poverty rate of Hong Kong? That is my question.
Okay, thank you. We do not have that much time, but I can take one more question or comments from you. Any of you? None?
Oh.
I don't see.
And James.
Yes, go ahead.
Okay, I like to point out regarding the carbon greenness. Usually, we can find them in the urban city in the Chinese society, but they are not. They may not be in poverty because some of them own the big house and big space in order to store those cardboard. So one of my neighbors, he was an elder cardboard collector. And when I was a commissioner in the Taipei government city, I did the informal survey to them and found some of them really own the big house and big space. So it's not necessary to be in poverty, but it is a kind of lifestyle. They are doing some recycle job, and also they are living in very frugal life. So that's I like to point out. Maybe for Stuart in Hong Kong, I think they are pretty similar. Thank you.
Thank you, James. Now I would like to ask each speaker to respond to the question, comments from discussant from any participant. Okay. Why don't we start with the first speaker, Professor Thang Leng Leng.
Hi, thank you so much for the questions, and thank you very much, Professor Hao, for your very insightful comments. I will just answer a couple of questions given the time limit. So the first one is Professor Shin asked about the family in Singapore. You know, this question of how is it possible for Singaporeans to take care of the families with all the concerns of changing demography, of more single rate, less children in the family, and so forth. Yes, as Professor Hao has talked about the Asian family debate, this whole thing also comes with Confucianism, filial piety promotion, and so forth. Started in the 1980s. And I have done some research looking at younger people to see, that what do they think about caring for their parents? And I feel that in Singapore, the children or young people are, in fact, they all know about family as the first line of support, and many of them, in fact, feel that they want to be able to support their parents. Of course, saying it and, this is just projection, right? So whether it's truth that they are able to do it because of all kinds of constraints, that's another question. But I think most people feel that, people do feel that they want to take care of their parents, if they can. And, sometimes the older sons may bring up things like I'm the elder son, the kind of cultural concept in trying to justify the answer. And I think it's also important that Singapore is so small. It's a small country, like similar to Hong Kong. It's so easy to get around to take care of your parents, even though you're not staying together. And in the report, I didn't say in the presentation, but in the report, I talk about the housing policy in Singapore, because our housing policy is more than 80% of them are living in public housing, and the policies from public housing is, in fact, very much, it will affect a lot of our living arrangements as well. So one of it is to live, incentive to live close to parents, as well as incentive to live together as multi-generational families. And I think all these policy incentives do make a difference in over the years in changing the idea of, hoping that people will live close to their parents to help the parents. But of course, we have to also bear in mind that quite often the parents are the one that help the children, right? The parents are the one that, provide the caregiving for the children, for the grandchildren and so forth. So parents are, that kind of intergenerational support can be two ways. Yeah. So I do think that there is a lot of concerns with how much family can care. And that's why more and more nursing homes are being built, and they are built also within the residential places, sometimes more and more, so that it's easier to provide, to enable family visitation and so forth. Yeah, so it will be a big issue, and we see that also with the future cohort of older people are also with better financial support in terms of the CPF, the Central Provident Fund. They will also be more independent compared to the current rate of elderly in terms of finances. And I think I'll go on to the question that Professor Kim talks about in terms of inequality of, one of the, as I said, one of the maybe invisible hands in the provision of care, as in Hong Kong and Taiwan, is that of foreign domestic helpers serving as caregivers. And in fact, it's also becoming common to see that older people are living alone and then having caregivers there are one foreign domestic helper to take care of them in the household. So there is inequality in the sense of, if we look from families' point, low-income families that I have studied, caregivers in low-income families, all the low-income families they cannot afford caregivers like this. So they are in more difficult situations without more support. But most of the middle class and families who need who have older people at home, caregivers from overseas, is actually play a very important role in enabling the women to go out to work as well.
We are a little bit behind the schedule, so.
Oh, okay. So yes, sorry. So can I just stop here?
No, 1 minute. You have 1 extra minute.
Okay, and then I would just say that in terms of inequality, there's also inequality. It's also the situation of the domestic helpers in Singapore. And so there have been civil groups trying to help them as well. And over the years, we do see improvement in policy to support them. But the situations, have a lot of room to improve further. Thank you.
Thank you. Stuart, it's your turn. Please go ahead.
Thank you very much, Professor Kim. Yeah, so firstly, just as a point of clarification, Hong Kong is not a country. Hong Kong is a special administrative region of the People's Republic of China. So this is important, this definitional point is made. Secondly, in terms of, in no particular order, I thank you, Professor Kim, for mentioning our paper in PNAS. So this is really about the extent to which changes in human capital and productivity can offset the challenges of population aging. But again, it's not guaranteed, right? And I think that's the most important thing, is that it's about the potential to offset some of the challenges of population aging. What is needed, and this goes back to Professor Hall's point about dependency and the ability for young people to reach their full potential in life, both their economic and social and cultural potential. And that requires kind of an institutional reframing of this. And I think that's what, and then again, to go to take a step back, and Professor Lee is not presenting right until the very end, but that's where thinking about the generational economy, I think, is so important. In terms of both the economic and time contributions of different generations, both in their own sake, but then also how these contributions are transferred across generations to each other. And unless we link them all together, we miss a big part of the picture. If we make people work for longer, but if the younger old population is primary child caregivers, then we are going to squeeze childcare, right? So we have to think about how these different generational transfers of time and money interact with each other. On Terry's point Professor Hall, very informal, on the reliability of statistics. We like to think in Hong Kong that our statistics are extremely reliable. We do have a very advanced microdata system, but on something like childlessness, there is no question in the survey that says how many children have you ever been. There's no children ever born question. So that number is calculated in a very kind of roundabout, complicated way. So even the things that we may assume to be taken as fact are not. And absolutely, the last couple of years, there is a tremendous uncertainty. And so then when we're thinking about the future and what the scenarios may be in the future, our baseline is very shaky. And I think that we have to recognize that we don't know what the future is going to be. I don't know what Hong Kong is going to be like in 2047 or 2050. The most that we can do as demographers, though, I suppose, is at least think about what possible futures there might be, and then try to edge ourselves towards the least worst option or the best option. And then the last point on poverty. I think that Dr. Shin's question on poverty is exactly what I was trying to get at in the discussion, which is we have to think about what poverty really means, and that's how we measure it, how we conceptualize it, how we define it. I think when Professor Xu mentions about cardboard grannies, I think perhaps he missed the part in my presentation, which is I said exactly the point that he's trying to make, which is that although we might look in the street at people and places and objects and reckon and see that as being poverty in some way, that may not be the case. We need to look in more depth about what the motivations, the real backgrounds to different people are, what their values and aspirations are, what their circumstances are, and not just either look at a person and judge them to be in poverty, or to look at a graph and say, well, that's the consequence of some policy which has brought people out of policy. It has to be much more human-centered.
Thank you, Stuart. I have one question about the Thai paper. even though we are a little bit behind the schedule, I would like to ask Professor Pramote to briefly explain about how Thai government has managed to cope with the inequality of income security system for the elderly. We are all aware that it's a tough question to be answered within a couple of minutes, but could you please give a try to explain very briefly? Thank you.
Okay. Your question is present perfect tense, asking how the Thai government has done to cope with the income security equality since the past to the present. Actually, Dr. Napaphat recently presented about the old age allowance for the elderly, which is very small amount for their living. This to cover those in the informal sector. Most elderly in Thailand are now in the informal sector, about 80% of all older persons. We have the Act of National Saving Fund 2011, which includes those in the informal sector into the pension system. But the participation in this fund is quite low. But when we think about the near future, when Thailand becomes a super aged society, I don't think what the government has done is enough to cope with the income insecurity inequality, which will be increasing tremendously in magnitude. I agree with the idea to establish a core agency at the national level to govern the entire pension system, as Dr. Napaphat suggested. There is no government agency to be responsible for managing the pensions for older persons in Thailand at the moment. This issue of income security inequality is a major research question in our country now. We are working on it, but no answer yet.
Napaphat, would you like to talk about the impact of COVID-19 on the welfare program briefly?
Yes, okay.
Yes, please
thank
go
you
ahead.
for your question.
Yeah.
Just briefly, I suppose that the COVID-19 pandemic hit us, all the populations very hard, including older persons. But in Thailand, as Professor Pramote suggests, we have about 80% who are in the informal sector. I suppose that this group was hit very hard by the COVID-19 pandemic, especially the low-income population, about 40% of Thai older persons. Because about 40% of the low-income older persons in Thailand, they are still working to make a living. They are still head of households, about 40%. It's quite difficult during the lockdown period, even though the lockdown period definition in Thailand is quite different from Western countries and also in Japan, in Hong Kong, and other areas in Asia. But it hits them very hard. So the government has tried to provide the social protection response to this group of population as well. But there's an obstacle that we can find that it's challenging as well, because most of the response that the government try to assist the people, they use the technology through application to internet. But most Thai older persons, although they have been increasing in using the technology over the last 2 decades, but it's still low. So they are not able to access fully to the response from the government. This is an issue that I suppose that in the International Day of Older Person this year is called the digital equity for older persons and all ages. So it is important as well to boost up the digital literacy for older people and also the future older person in this sense.
Thank you.
Over to you.
Looking at chatting window, I saw the note from Terry about the role of religions in 3 cases. But if you don't mind, Terry, would that be okay if we talk about it at the conclusion session? We are about 12 minutes behind the schedule. So,
Sure.
we are going to take a short break, and then, on my watch, it's 2:52. So we will make the break short from 20 minutes to 15 minutes. So could you please come back to this conference room by 3:10 Seoul time, which is about 16, 17 minutes from now. Would that be okay?
Okay.
So all the speakers, discussant, and all the participants, thank you very much for your participation and contribution. In the second session after the break, we are going to have 3 presentations on Japan, Taiwan, and Korea. So we will be back by 3:10, which is 17, 16 minutes from now. So why don't you take a break, have a coffee or, whatsoever. Okay, thank you very much. Thank you all indeed. Welcome back, everyone. I was just confirmed that everybody got back to this conference room. So we now begin the second session. And our next speaker is Dr. Toru Suzuki from Japan. He had been Deputy Director General of the National Institute of Population and Social Security Research in Tokyo until he retired a couple of years ago. But he is still very active. His research focuses on low fertility, demographic transition, and population policies in Japan and East Asian countries. The title of his presentation today is Population Aging and Social Security Cost in Japan. Please join me in welcoming Dr. Suzuki.
Thank you so much. I hope sound is all right. And thank you so much for offering this opportunity to participate in this important meeting. I'm talking about financing social security system in a very aged and still aging country. You know, Japan is presently the most aged country in the world. And according to the medium variant of the projection by the United Nations Population Division, Japan will stay its position for more than 30 years, probably the longest period after 1950. This is a list of countries and areas that used to have the most aged, oldest age structure in the past and will have it in the future. Channel Islands in the English channel was the case that migration had a big impact on a small population. Those islands were occupied by Germany during World War II. Children and youngsters left the island before the occupation, and during the occupation, many workers were relocated, and only old islanders were left. Austria became the oldest country in 1970, but quickly replaced by Sweden. And other countries other than Channel Islands are characterized with low fertility. Sweden is the light blue line in this graph, and the fertility was lower in 1950s, 60s, and early 70s than most other European countries. I included Germany, pink line in this graph, although Germany have never been the oldest country, but it took the second and the third place many times. And in the case of Sweden, in addition to lower fertility than other European countries, Sweden was the country with lowest mortality in the world until replaced by Japan in the late 1970s. And so Germany was not necessarily the country with low fertility, but fertility was very low when second demographic transition started in Europe in the 1970s. And after that, Sweden was replaced by Italy in around the turn of the century. And the reason would be very, very low fertility in Italy. Green line is Italy in this graph. And when lowest low fertility hit Europe in the late 1980s, Italy was top runner of the fertility decline in southern and eastern European countries. Then Japan became the most aged country after 2010. The fertility of Japan was lower than most advanced countries in the 1950s and 60s because post-war baby boom in Japan lasted only for 3 years, ended in 1949, and fertility acutely declined in Japan in the 1950s and 60s. And in addition to relatively low fertility in Japan, Japan was the country with the lowest mortality in the world. So it made Japan the most aged country in the world recently, and will stay this position for more than 30 years. And Japan will be replaced by Korea in 30 years from now, according to the United Nations. And the fertility of Korea, as you know, has been lower than Japan since around 2000. And it recorded 0.84 or something last year. This year, someone says it could be around 0.6 or 0.7, terribly low fertility. And Korea quickly caught up other advanced countries in terms of life expectancy of birth, and will replace Japan around 2050, according to the United Nations. Actually, Japan and Korea started from very young age structure in 1950. So the two countries took long time to catch up with other developed countries. And but I think the projection by the United Nations may be a little optimistic. And official projections in Japan, Korea, and Taiwan assume lower fertility than the United Nations did. And comparing three official population projections by 国立社会保障人口問題研究所 in Japan, Tongye-chan in Korea, and Koja Pudian Wei Wing-Wai in Taiwan. Korea will overtake Japan by 2045, 5 years earlier than the projection by the United Nations. And Taiwan will overtake Japan in 2055. And so, looking at recent extremely low fertility in Korea and Taiwan, even these official projections can be too optimistic. And in that case, Korea and Taiwan will overtake Japan earlier than the projections in this table. Okay, I compared 12 countries' social costs using OECD social expenditure database. I chose countries from 6 blocks, from famous European welfare nations, France and Scandinavian countries, and German-speaking countries, Germany, Austria, and Switzerland. And from Southern Europe, I chose Italy, Spain, and Portugal. So there are 5 English-speaking countries, including the US and the UK, and Japan and Korea from Eastern Asia. So as for the total social cost, Japan is replaced at the middle of these 12 countries in spite of the oldest age structure. So I wanna take a look at social expenditure by function. While Japan has the oldest age structure, Japan spends less than other old countries like Italy, Portugal, Finland, or Germany. And so this is vertical axis is always percentage of GDP. Okay? And the correlation between life expectancy at birth and public expenditure on health function is weak. And actually, Japan spends more than the regression line, but less than European countries or the United States. And so this shows the correlation between TFR and the costs of family policy. So the correlation is stronger than those that between mortality and health expenditure. And Japan spends low costs on family as low as other southern European nations. And some Eastern European nations like Hungary and Poland spend higher costs than regression line, probably due to the momentum of socialist period. The United States is apparently outlier in this graph, spending practically nothing on the families. And so naturally, country with high unemployment rate needs to spend more for unemployment function. It is fortunate that Japan does not need to spend as much as Southern European countries for unemployment costs, social costs. And this shows the relation between poverty rate and other social expenditure. So I'm not sure how much variance in the percentage of other social policy on poverty control. But anyway, it seems that Japan is less generous than United States or Korea in terms of poverty control. Okay, so this is the characteristics of Japan in comparison with other advanced countries. Now I turn to the recent institutional change in Japan's social security system. This compares the tempo of population aging and the increase in social expenditure for all ages, mainly pensions, old age, retirement pensions, and long-term care services. So long-term care insurance started in Japan in 2000. And so at the early stage, the cost for long-term care institution grew rapidly. But pension reform were made. A major pension reform were made in 2004. and many interventions, including prolongation of beneficiary age or the reduction of benefits or the increase in pension premium gradually applied, and the recent increase rate of old age social costs are lower than the tempo of population aging. This shows the increase in the cost of pension, and green line, and long-term care insurance, pink line. Actually, the pension, retirement pension accounts for 80% of old age social cost, and long-term care insurance accounts for about 18% or something. So the trend of old age social costs is governed by the trend of pension, and the growth was historically low in 2010 to 11 because of the price slide and the prolongation of beneficiary age determined in 2004 were applied. And so this shows tempo of population aging again, and increase in the cost of health. So actually the health cost declined in 2002 because of 10% co-payment was enforced this year, and also there was update in national tariffs of medical care. And the big increase in 2015 was not a real one, but because of the statistical change that local governmental program was started being included into the statistics from this year. And in 2016, again, there was update of national tariffs for medical care, and it curbed the growth of health costs in Japan. So this shows the trend of the number of births and increase in the social costs on family policies. And so in Japan, there Democratic Party took the governmental power in 2009, and the new government introduced a big expansion of child allowance program in 2010, but it turned out there's no budget for such big child allowance program. So the institution returned to the former formula. And actually, the social expenditure on family declined in 2012 or 13, something. And the big increase around 2015 is again from the caused by the statistical change. It's not the other one. And so recent increase is due to the expansion of early child care and education program. In Japan, consumers tax was raised from 8% to 10%. So some parts of increased governmental revenue were spent for the family policy, especially for pronatal policy. So it caused increase in the social costs on family policy. Okay, but still, the number of births has been declining. So the pronatal policy in Japan is not so successful. Okay, so this shows the summary. So Japan's position as the oldest age structured is due to relatively low fertility and very low mortality. But it took a long time to catch up with other advanced countries. And Japan spends less for old age supports, including pensions and long-term care policies, than European countries. And various pension reforms decelerated the growth of pension costs. And the social cost on health in Japan has been curbed by the introduction of long-term care. So in Japan, there was the problem of so-called social hospitalization because long-term care costs used to be very high, and all the patients stayed at the hospital even after their condition required no medical care anymore. I think introduction of long-term care insurance in 2000 in Japan reduced the cost of health. And also there was some updates in national tariffs for medical care that also contributed to slowing down the cost of health. And so Democratic Party there, so the expansion of child allowance was only temporary, and it returned to the old formula. I think it caused bad effect on the trust for governmental policy among ordinary Japanese people. And also all the pronatal policy expenditure has been growing recently using the increased governmental revenue due to the raised consumption tax. It's still not successful to recovering fertility rate. This ends my presentation, and thank you very much.
Thank you, Dr. Suzuki, for your presentation with various graphs based on the cross-national data. It was interesting to learn from your figure on slide number 15 that due to the Medicare reforms, particularly in the year 2002, the increasing pace of health expenditure has been slower than that of the elderly population during the past 2 decades. Well, anyway, we will now move on to Taiwan. And next speaker is Dr. James Chung Tae-Xie from Taipei. He had been professor of sociology at National Taiwan University for 20-some years until he retired earlier this year. He also served as Minister without portfolio of the Taiwan government, in charge of Austr, welfare policies and labor issues. The title of his presentation today is Social and Health Policies in Response to the Rapid Demographic Change in Taiwan. I understand that James submitted a videotape of his presentation to the conference organizer. So is it ready to be uploaded now? Please go ahead. I'll let you have a chance to talk after we listen to the video, okay?
Can I talk? Okay.
After the video.
Hello, everybody. I'm Jian Xue from National Taiwan University. I'm one of the authors regarding the policy response in Taiwan. There are 3 sections in the paper and also in this presentation. I'm in charge of the first section. The first section, the demographic change since 1950s in Taiwan. The first slide shows you the basic demographic trend in terms of CBR, CDR, and natural increase rate. Also, the population size. So, most importantly, the CBR declined from 50 per thousand in 1951 to 7 in 2020. While the CDR changed not much. The lowest, less than 5 per thousand, occurred around in 1980s. However, the total population size increased from 7.9 million to 23.6 million, 3 times of increase in 70 years. However, it turned into a decrease last year. This table provides you the basic demographic features in every 10 years, 1951-61 to 2020. Okay, the items in an decline trend, such as CBR, NIR, TFR, and marriage rate. And in an increased trend, such as CDR, age of first marriage, and age of first birth, and the share of the elderly, and also the life expectancy for both males and females. And they are also in green, means a turning point, such as the total population. It will turn out to be a negative increase, and also the divorce rate and dependent ratio. This slide shows the same thing, the demographic trend, but in terms of the TFR, total fertility rate, and the number of births annually. And in the 1951, the TFR was 7, one of the highest in the world, but it declined very fast. It dropped to 2.1 here in 1984, the replacement level. And then it hovered around 1.76 for around 14 years, between 84 to 97. And again, after that, the fertility rate declined, and also the newborn babies declined over time. The Taiwanese baby boomers, as I called, they were born in 1951, between 51 to 66. On average, more than 400,000 babies born in each year. But now, last year, we have only 165,000 babies born. So the population crisis, actually, it seems to me, is it happened since 1997. And I also like to point out one thing. in the year of the 2010, during the global financial crisis and also the year of tiger, Taiwan experienced a new record low of births, only 167,000 babies, and fertility rate was 0.9. But these figures rebounded, and in 2011 and 2012, respectively, and mainly due to economic recovery, dragon year in 2012, and the implement of prenatal measures in 2010. So the average number of newborns was 210,000 during 2011 to 2015. The TFR rebounded to 1.2. So just in summary, so Taiwan experienced fertility decline late but fast on one hand, and the other hand, aging late but fast. And the fertility rate was very low in Taiwan at the turn of the century. Why no any actions from the government in response? So before the year 2009, very few cabinet members supported the measures for booster birth due to the thought of very high population density. In Taiwan, 650 persons per square kilometers. So I addressed in the cabinet meeting in 2010 when I was a minister. I said that in years 2000 and 2040, the population size are the same, 22 million, but the share of the elderly will increase from 8.6% to 30%. So that means the impact of the change in population structure would be stronger than population density by the year of 2040. So that's why I suggest that policy priority should be changed. I also agreed on the environmentalist thought. However, because the population size will not change much by the year of 2040. So the first priority should be slow down the population aging by way of implementing prenatal measures. So that's why we have a recuperation of the births and fertility in the subsequent years. Okay, these are the measures I proposed in the 2010. They are pretty much the same as almost all the countries. However, I emphasize that the last one, number 9, social value and the lifestyle are more important for boosting the birth. And the major goal is to slow down the aging speed. Okay, now I show you the a projection from the UN World Population Prospects. Okay, it's the share of the elderly population in China, Taiwan, Korea, Taiwan, Japan, India, and USA. So it's very clear. Taiwan and Korea, according to UN's projection, the population aging rate very fast in between 1915 to 2015. In Taiwan, we reached the aged society in 1992, the aged society in 2018. And we are going to step into the super aged society in 2025. So Taiwan and Korea are alike, aging late but fast. Okay, if we further compare the fertility rate from the year 2000 to 2019 for Taiwan, Korea, and Japan. Okay, is Taiwan. In the year 2000, TFR was 1.68. And 2019, only around 1. Okay, this is Korea. Korea are pretty much the same as in Taiwan, but after the year 2015, TFR are lower in Korea. Japan, it was the lowest in the year of 2000, but it seems did much better. Okay, then I step a little further to compare the Taiwan and Korea in terms of age-specific fertility rate. Age, okay, I didn't spelling wrong. Age-specific fertility rate. In Taiwan, it looks like this. From the age cohort of 20 to 24 to 40 to 44. Korea looks like this. If we compare these two pictures, you will find that in Taiwan, the age bracket of 20 to 24 and age 25 to 29 did better than those in Korea. But for the age 30 to 34 in Korea had a higher fertility rate than in Taiwan, but it declined in recent years. So if we look in the next 10 years, I would say that Taiwan probably will be the lowest, will be the lower fertility than in Korea. Okay, I just finished the first section, and the section 2 regarding the social policies in response to the change by Professor Gu. And in the beginning, he introduced the 3 golden decades of the welfare development in Taiwan. Okay, 50s, 70s, and 90s. I don't have time to go in detail. And he pointed out that the Taiwan's social expenditure by functions, a little bit more than half for OH, and followed by the disease and health, accounted for around 1/3 of the total expenditure. Okay, right here. And he emphasized that Taiwan welfare regime can be treated as the peace-making social interest system because of the social insurance occupied around 70% of total social expenditure. However, if the system, the sustainability of the system needs a healthy population structure, unfortunately, Taiwan now are facing the low fertility with age population. So it implies that less contributors and more pensioners, it would result in a significant shortage of the pension funds. That's why we carry out the so-called pension reform in the past few years. But it seems it didn't work well. Okay. And the recent new policy response, the government are building the social safety net on one hand, and also implement the new family policies. However, okay, I just go to to this slide. The Professor Gu emphasized once and again that the fiscal burden are increasing while the government hesitate to increase the tax. So that's why he said fiscal constraint. The Taiwan's average tax burden rate is lower than most of the developed countries. if you just look at this table, Taiwan in 2019 only 13%. If you compare the Korea, USA, France, and Germany, and also Japan, Taiwan is the lowest. So he suggests that it's necessary to think about how to strengthen Taiwan's taxation base. Now I move to the section 3, health policies in response to the change by Professor Li. And Professor Li, he described the evolution of health and the long-term care system. So the key issues are here. The launch of the national increase insurance in 1995. And also the government implemented the long-term care plan in the year 2008. And the Long-Term Care Service Act in 2017. Now the government carried out the Long-Term Care Plan 2.0, started from the 2017. And here are the major reform of national health insurance. Okay, and I don't want to go in detail. Just take a look after my presentation. And the difference from the long-term care plan 2.0 from the first version is the source of the revenues. So according to the new law of the sources from tobacco tax, heritage and gift tax, and government budgets. So the last year, the budgets for the long-term care plan was 40 billion NT dollars. So it increased a lot. And of course, there are something in detail. And then the performance of the insurance, health insurance, so has achieved universal coverage with the relatively low cost, only accounted for 6.3% of GDP, and it improved the Taiwanese population health. And the long-term care plan 2.0 also increased the coverage rate up to around 55% of the target population. And Professor Li also pointed out the challenges and the recommendations. First, inefficient and ineffective delivery and payment system. And also the low fiscal capacities and sustainability and inequality in the population coverage. So both Professor Gu and Professor Li emphasize the low fiscal capacities, and they are worried about the sustainability of the welfare and the health policy systems. The final, I will give a conclusion. We all know that the population aging are caused by the low fertility rate and the longer life expectancy. And the population aging, we are all facing the increasing old population and longer period of being elderly. And of course, we are also facing difficulties, which are fewer family caregivers and the long-term care in need are increasing. Okay, in this paper, in our paper, I emphasize that the late marriage and late birth, no marriage and no birth, are the major reasons to cause the low fertility rate, particularly in the last 20 years. And health and social welfare policy, and also the social economic change and technology development are the backgrounds. So they interact with all these things. Thank you. The end.
James? Can you hear me,
Okay,
James?
can you hear me?
Okay. If you want, I can let you have a minute to say hi to the participant, or perhaps you may want to introduce yourself and your co-authors.
Okay. First, I'd like to thank the Professor Kim and Professor Shin invited me to join writing the paper and doing today's presentation. That kept me very busy. Immediately after my retirement on August 1st. So in order to control my time, so that's why I pre-called my presentation. And so I hope these things are a little bit slower. It works well. Thank you very much.
Thank you, James. It was good to have 4 more minister's interpretations of the current direction of welfare policy and his recommendations for the future implementations. We are a little bit behind the schedule, and we will move on to the final presentation, which will be made by Dr. Yoon Jung-shin, Senior Fellow, Research Fellow at the Korea Institute of Health and Social Affairs. She's been active in conducting international joint project, and her research mainly focuses on low fertility, family, gender, childcare, and welfare. The title of her presentation today is Population Changes and Health and Welfare Policies in Korea. Please welcome Dr. Shin.
Thank you, Professor Kim. Okay, can you share my screen? Okay. Hello, everybody. The title of my presentation is Changing Population of Korea, Challenges for Welfare Policies. For my presentation, I will briefly look at population change in Korea, status and prospect of social security finances, and the effect of income security system on income and poverty. And I will briefly look at the issues and strategies on healthcare, pension, and social service policy. And I will make conclusions. And these are the interim result of our project. And I welcome everybody's comment for me to have some intuition to conclude my project. Okay. Main drivers of population change in Korea is a sharp decline in fertility rate and increased life expectancy. Previous presenters showed that the fertility rate of Korea is very low, and it was 0.84 in 2020. And the life expectancy is over 80 years old, both for men and women. And so the number of births are declining, and the number of deaths are also increasing. So we expect the natural decline of population began. The natural decline of population already began in 2019. And the total population of Korea is expected to decline from 2028. And the working population also is declining, and the elderly population is rapidly increasing. Proportion of working age population was 73% in 2070, but it will be declined to the 45% in 2067. And the proportion of elderly population was 13% in 2017, but it will be increased to the 46% in 2017. So the total dependency ratio will be over 70 in 2038, and it will be over 100 in 2056. And Korea is getting older and older. The median age was 42 years old in 2017, but it will be around 62 years old in 2067. The baby boomers who were born between 1955 and 1963 started to retire from 2020. And the retirement of baby boomers will have a significant impact on overall social security policies, such as pension and health insurance policies. Population distribution also a big issue in Korea. Local population are declining, so the local annihilation fears are mounting due to the local population outflow. Also, population concentrated in the metropolitan areas, and it leads to the problem of spatial imbalance in distribution of health and welfare services. Now, I will show the status and the prospect of social security finances. Public social expenditures as a percentage of GDP was 12% in 2019, and it is still lower than the average of OECD member countries, but is steadily increasing since 1990. Healthcare accounts for the largest share of the spending, followed by the care for the elderly. And similar to the Taiwan, social insurance accounts for the greater share of fiscal expenditures than public assistance or social services. The national pension and health insurance scheme account for a large proportion of social insurance expenditure. The national burden rate and the share of social security contributions were lower than that of OECD member countries, but is growing at a fast pace. The national debt ratio of major countries with aging population has increased every year since the first becoming aged society. And Korea's national debt may increase as its population aging intensifies. These are the prospects for Korea's social security finances. Korea's aging population is expected to affect overall social security spending, especially social insurance spending. So efforts are needed to ensure financial sustainability of health insurance and national pension system. The financial resources required for social security expenditures due to aging of population can only be met through the increased public burden or national debt. So it is necessary to explore how social security expenditures will be financed, and the social consensus on the issue is needed. And next, I will show our empirical result on the impact of income security system on income and poverty. These are the empirical examination of how Korea's income security system has responded to changes in the demographic structure. I used the data from Statist Korea survey of household finances and living conditions from 2011 to 2019. And I used the methodology of decomposition and standardization. And these are the concept, the definition of a main concept of our analysis. And due to the very limited time, I will just show you the main result. The demographic changes such as aging population and an increase in the number of elderly living alone act as a factor that reduce the income level of the entire population, and it increased the risk of poverty. However, the expansion of income security system and tax system plays a role in suppressing the risk of poverty due to the demographic changes. And also expansion of public pension and basic pension plays an important role in reducing old age poverty over time. Also, the reform that strengthening the income security for working age group are also effective in reducing poverty for the entire population. And these are the implications of my analysis. Korea's income security system has the effect of moderately reducing the disposable income poverty rate. So Korea's income security system operates as a mechanism to suppress the effect of demographic changes that increase poverty. So we may say that the recent reform of income security system can be evaluated as a rational response strategy in response to the demographic change in Korea. Now, I will briefly show you the main issues and strategies on healthcare, pension, and social service policy. I will be very short. It is a very much detailed story, but I will be very short. The issues on the healthcare policy are changes in the health insurance revenue sources and increased need for primary and nursing care, and growth in the vulnerable population and changes in the disease structure. And the regional disparities in access to healthcare also a big issue. And Korean government responded, and they make many policies to respond to these healthcare issues. And these are the strategies for healthcare policy which are proposed by our project, my colleague. We need community-centered medical care, welfare integrated service provision. Also, we propose to reinforce chronic disease management capabilities in primary care. And we need to secure stable financial resources and rationalize health insurance spending. And we need to establish complete regional medical system at the regional level. And these are the issues on the pension policy. Imbalance of national pension system, relevance in terms of contribution, adequacy of benefit, increase the local government basic pension burden are major issues. Unfortunately, for pension policies, Korean government did not do much reform the policies. The reduction of replacement rate of the national pension income was just conducted 2 times in 1999 and 2017. And reform of civil servants' pension was conducted only 1 time in 2015. And that's it. Still, the national pension premium rate kept at the 9% since 1998. And age limit to join the national pension is still 59 years old. And there was an insignificant increase in national pension benefit. And the retirement pension enrollment rate is still very low. And these are the strategies for pension policies which are supposed by our project. We need a parametric adjustment for the fiscal sustainability. We need to introduce an automatic balancing device. And we need to extend upper age limit for membership. And we need to increase insurance premium. Also, we have to rationalize benefits through pension policy reform. We need to expand basic pension to guarantee minimum old age income and introduce supplementary old age income support. And also, we have to improve equity between the national pension and the special occupation pension. And besides the pensions, reform of pension policy, we also need to expand the elderly labor market. We have to extend the retirement age, also create a condition that enable the elderly to earn income. Finally, I will show the major issues in social service policies. The demanding for the child care is increasing, youth employment and vulnerability among the middle-aged people is increasing. And lack of supply and low quality of elderly care service is also a big issue. And there are demand for services in provincial regions. And Korean government are actively initiate many policies that respond to the issues on the social service policies. And these are the strategies for social service policies which is proposed by our project. We need to strengthen poverty safety net for young children and the elderly, and expand social service for young and middle-aged, and create the environment of community-oriented social service policy. And we can summarize our proposed policies as follows. We need to satisfy the demand for health and welfare that arises amid demographic changes. And also we need to devise a plan to raise the necessary financial resources. And we also have to pursue structural reform of the system to improve the efficiency. And I will conclude my presentation. Korea's changing population is creating a challenge for health and welfare policies. And social security spending in Korea is currently below the OECD average, but is expected to increase in the future as population changes rapidly. Korea's income security system effectively reduces the impact of population changes on poverty, and it could be considered as a reasonable strategy to respond to demographic change. However, we need a fundamental restructuring of Korea's social security system due to the aging population. To prevent the surge in healthcare demand, it is necessary to extend health living and proactive health management policy. Together with the reform of pension policy, it is necessary to create conditions in the labor market so that elderly can work. And in the case of a public assistance and social service project, along with the expansion of target, the efficient and effective operation of policies is required. So, this is my final remark for my presentation. The challenges of welfare policies of Korea. The challenges are how to effectively we meet the growing demand for health and welfare in response to demographic change, and how will the financial burden be shared equitably between generations and between classes, and finally, how we achieve the structural reform of the systems for efficiency. And this is the end of my presentation. Thank you very much.
Thank you, Dr. Shin. To be very frank with you, you made me very worried about how you're going to manage to finish your presentation within short period of time, but you did a superb job. Thank you. Well, we have listened to 3 presentations in the second session, and I'm happy to invite Professor Sang-Hyup Lee for comment and questions. Professor Lee has been teaching at the University of Hawaii for 20-some years and currently serves as a chair at the Department of Economics. He's also senior fellow at the East-West Center. And he has a large amount of publications on the topic of labor market, aging, welfare, and national transfer account. Professor Lee, please go ahead.
Thank you for nice introduction. So without any further ado, let me share my screen. Oh, okay. Can you see my screen? No?
Not yet.
Not yet. Oh, yeah.
Yeah.
Probably.
Yeah.
Right? Okay. So, I enjoyed actually reading the papers, and they're very interesting and so read, and they address very important topics. So, we can still, there is no silver bullet, right? So each country is different, and but you can still learn from others' experiences. That's actually the purpose of this conference, I think. It's not actually about these specific papers, but for future work, it will be better, even better, if future studies can add more on big picture, where they are actually heading to, what are their policies. And issues on sustainability, effectiveness of policy. So I just talk about these 3 things today. And some results actually, some numbers especially should be interpreted with caution. So, okay, so let me give you the picture. So in this case, this shows the consumption, which include actually public consumption as well, public health consumption, and labor income per capita by age. So it's obvious that actually elderly consume more than they produce through their labor. So, I mean, children as well. So they have to rely on something else, right? So that's actually the dilemma of the population aging. So there are only three ways. There is no more way. You either rely on family, rely on government, social protection, or you save when you are young and use it. There is no other way. So 10,000 years ago, no government, there is no banking system, there is no government. So what you should do, you should rely on family. So you are dependent on the family members, but it deteriorates, right? So there are two ways. You can move on to saving-based, I call it capital-based transformation, or you can move on to social welfare transformation. Okay, there is no other way. So countries moved this way. This is based on our national transfer accounts data. So of course there are European countries, they are welfare state. They moved to welfare state. But you know, like 300 years ago, there were no welfare state. So they were like developing in Asia these days, right? So they relied on family system, then moved asset-based, then moved down, like Thailand, and Korea, Taiwan, and Japan is now actually close to, I mean, between US and the European countries. You may actually wonder why Singapore is here. Actually, Singapore's public transport system is actually less than Korea or Taiwan because, especially in large part because they rely on the forced saving, provident fund. So it depends on actually their mechanism. How they build their old age support system is the big question, is the big picture. Thailand is actually very, very interesting case because, I mean, it's indicated first in their 8th Economic and Social Development Plan, as well as in Constitution 1997. And since then, actually, they moved very fastly to Social Development Plan. So in 1991, actually, 2/3 of the population didn't have any, I mean, medical insurance whatsoever. There is no plan. But in 2001, actually 2002, they introduced this universal healthcare system. And then if you look at their recipients of benefits and the government actually budget, beginning 1993 to 2002, and then after that, it increased this way, like rocket. So what happened in Thailand actually is that before 1997, their family support system has been deteriorating. But before 1997, there was no social welfare system. Then they quickly moved to public transport system. Now, actually, they have a question. They continue to do that, or they rely more on like a US system, asset-based. So this is a big question. So about 4 weeks ago, the Minister of the Ministry of Finance, Minister Arkham of Thailand actually joined our meeting. And he actually made it very clear they will move this way instead of this way because this is not sustainable. So they introduced the forced saving system instead of pay-as-you-go pension system this year. And they moved to community basis. That means actually the government cannot sustain this rapid change in social protection or social welfare system. So this is a big question for every country actually, where they are heading to. This is a big picture. So there are only 4 ways. If you actually add work more, then there are 4 ways, right? So work more. So it's appropriate and inevitable actually, but not sufficient to meet the challenges in some countries, especially Korea is the case. So Dr. Shin actually mentioned, I mean, everybody mentioned that we should actually delay retirement and increase the pension eligible age. For Korea, Korea has the highest labor force participation of elderly already. But also at the same time, actually, Korea has the highest poverty rate of elderly in the world. Why? Because it's not about the quantity. It's not about whether working or not. It's whether, the question is whether they have a decent job, right? So that's what actually Dr. Shin mentioned, that there is an issue on labor market structure. So in Korea, I mean, I don't know whether the participants know it, actually, many people actually retire from their former job, their first job at age like late 40s or early 50s, actually early 50s, most likely on average. And they actually open on like a restaurant and chicken and beer shops. Many people are becoming self-employed. So working more is definitely appropriate because people live healthy and longer and inevitable, but the impact in some countries are not that much actually. How about increasing family transport? That means actually you're going back to this traditional family support system. It has a very important support system in Asia, but it's deteriorating in most countries. Actually, Singapore and to some extent Taiwan is an actual exception. I think actually these two nations are the only exceptions in the world. We actually have 90 country data, and they are the only two exceptions actually who stress this more than the others. Whether this is sustainable is the question, because there is issues on declining fertility and women's increasing labor force participation, urbanization, and most of our actually consensus. We have data on like in Korea, whether the young people actually want to support their older parents. If you compare the data set like 10 years ago and now, people don't want to live together. People don't know they are actually elder parents. So that's actually one issue. And how about increasing public transports? Maybe inevitable for some countries, right? Still. And because inequality is rising and they still have a high poverty. But the issue is actually COVID-19. I will show some numbers, but after some shock, like 2008 international the financial crisis or COVID-19, it's very difficult to actually decrease public transport. So because of COVID-19, it is probably inevitable. But is it sustainable? You already know the mismatch between taxpayer and the beneficiary, right? So it leads to a huge debt or intergenerational equity problems. So this is actually major problems in many advanced economies, and some countries are actually becoming very, older. People, they get rich, some Asian countries. And how about the last option, that decrease public transport and the more reliance on saving or human capital accumulation? So it's probably also inevitable for some countries. And that's why many countries actually implement the reform. They reduce the replacement rate. The Japan is actually the interesting case, right? Because they, Professor Suzuki, Toru Suzuki actually mentioned that, they have this Kosei Nenkin, the employee pension insurance, Kokumin Nenkin, the national pension insurance, but they actually implement a lot of reform to reduce it. So if they reduce it, the people actually can, if they reduce the public transports, then they should save more. And the human capital investment is one way. That means lifelong earnings, but or educate more children. Children spend more on education. But one issue is actually in some countries the public system is failing. Public education system, for example. So they rely on like private education. That's the case for actually Taiwan and Korea as well. They spend a lot of money on private education. So inequality is an issue. So inequality is rising. Then can you actually rely more on saving or human capital accumulation? So there is no panacea. There is no silver bullet. So countries should choose one of these. And like Japan is relying more on number 1 and number 4. Korea is doing both number 3 and number 4 and trying to do number 1, but there is an issue. Why? Because the labor market issues. And Singapore is actually using this one. Singapore doesn't have much problem on public transports because from the beginning, they started with the Provident Fund, enforced saving rather than pay-as-you-go system. So that's the big question. What are the system of the country and nation and where they are heading to? The second question is whether it's sustainable. So we already have seen a lot of social welfare spending as percent of GDP. So if we look at like this top is actually Sweden. So it's actually mislabeled, but the top red part is Sweden. Sweden, Finland, and every countries in European countries, they increased their social spending very rapidly in 1990s. And then it peaked in mid-90s. What happened? They implemented reform because it's not sustainable. It's like when they reach like 33% of GDP, they had to decrease. So Sweden and Finland started the reform. Germany too, actually. They started like the restart plan. Then, this black is actually OECD. And Japan and Korea increased their spending. because their level of spending was low. But look at the 2008. What happened? In 2008, every country had to increase their social spending. Then after 2008, Sweden still continued to do reform, but Finland was not. So the natural question is, this is 2020 and 2021, right? So after COVID-19, we'll see very similar picture. So what's the country's plan after COVID-19? It will look like Finland, Sweden, or Korea or Japan. And so that's actually a really big picture. Another thing is, okay, sorry about the Korean language. The yellow is Korea. So you already have seen that the Korea's social spending is about 12%, right? Yeah, as of 2018, 2019. So it has one of the lowest actually spending in terms of level. But if you look at the speed between 1990 and 2018, it's by far the highest rapid. I mean, 5%, more than 5% per annum for 28 years. 28 years. In history, there is no actually countries which increase the social spending this way. If we look at the bottom, that's Netherlands, Ireland, and Sweden, they are negative because this is a share of GDP, right? So it's actually very interesting. If you look at like Korea's political parties, some political parties actually stress the left part, okay, because it is so low. But some people actually say, look at the right-hand side. It's increasing so rapidly. So depending on your view and depending on what's your view about the social protection policy, you will probably have a very different views. So many people actually address this one and stress the left part. But also we have to look at the sustainability part because we just actually finished this paper. I just finished this paper with Andy Mason. We are receiving a lot of calls because these numbers doesn't look right? I mean, even solely due to aging, the public debt could be 800%. Of course, it's not going to happen. I mean, of course, there is an assumption on interest rate, but even without zero interest rate in Korea, it could be at least 300%. That's not possible. So there should be reform. Actually, that's kind of some implication of this one. And Singapore is low. Why? Because, I mean, with the current actually public system, social protection system, it's actually okay, looks okay. Now, that previous figure assumed that there is no increase in per capita social protection. But if you look at Taiwan, this is per capita by age, 1993, 2015, we have this data. It increased this way. The pattern is very interesting. It's actually over 25 years, 14 years. In Thailand, social welfare increased for every age groups. In Taiwan, it's for actually the age for very young people actually it didn't increase, but for older people it increased substantially. Japan is a very, very interesting case because it increased gradually, but between 1999 and 2004, it increased substantially. And I believe this is because of the introduction of long-term health care. If we compare with the children transferred to education and daycare or whatever, so it's increased this much relative to a ratio of labor income, but for older people, it increased substantially. Korea is a very interesting case. Even very short period of time, it's just for 6 years, they show actually huge increase for very older people. And so every country is different. The fun implication is every country is different. And like Thailand, the increases for every level. For Japan, it's mostly for the elderly. For Korea, actually elderly. I believe this is related to the introduction of long-term health care in 2008. And Taiwan is a very, very interesting case. So, but another implication is this is solely due to aging. But if countries actually increase the social welfare, this way may not be sustainable. So one way is to increase taxes, but some presenters actually already mentioned that it's not very popular. So this is the left-hand side is actual tax profiles as a ratio of their labor income in Japan every 5 years. But to make their fiscal balance, the tax profile should have been looked like this on the right-hand side. So that's why the public debt actually has been increasing because, and also in Japan, they rely their tax on consumption tax, not the direct tax like income tax. So the question is whether, the debt is already over 200% and it will increase very substantially unless they actually increase more taxes, but that's very unpopular, right, amongst the political parties. So that's the issue. Also, Professor Suzuki Toru actually talked about this substantial change in 1985 and 2000 and 2004 change. But the question is, this is more like a parametric reform, right? So in 1985, they cut the wage proportional benefit from 10 to 7.5, and in 2000, they decreased it to 7.125. 30% cut of benefit. But in Japan, the replacement rate is already low. So can they actually further lower the social benefit, replacement benefit? And Korea is actually more problematic because people actually retire from their former sector very early, and they may actually fall in poverty trap if the government increase the pension eligibility. I have a couple more slides. I really liked actually Dr. Shin's the analysis of using the 가근복 data, comparing disposable income inequality versus market income inequality. So there is actually every country analysis by estimate by IMF. So these are the red dots are actually Latin American countries. So if it's a straight line, there is no effectiveness. So as the country actually move further from the diagonal line, it's more effective. So it's actually very interesting because Korea is all kind of tax and social policy is not as effective as other European countries. It's very close to diagonal, right? That means it's less effective. So people actually raise the question: Korea is still behind in terms of its effectiveness, but Dr. actually showed this, very interesting, the data using the 가근복 data, the Korea's data. Korea's focus is not reducing inequality, actually. Korea's social protection policy is to reduce poverty, especially older people. So this shows the poverty rate of total population versus the poverty rate of 65 and older. So in Japan, it's a predicted line. And most countries are actually here. Korea is here. Korea is the highest poverty rate to elderly. Relatively, of course, this is a relative poverty. So the target effectiveness should be focused on actually reducing poverty, and I think that's the right way. So that's actually I'm glad actually to see that kind of change instead of just looking at the all effectiveness of the Gini coefficient. My last comment is that it's just very minor. The numbers should be interpreted to caution, right? Especially when you talk about social security tax or social security contribution or taxation. Because, for example, if you look at Sweden versus the US, Sweden's social security contribution is twice as large as the US. But it's just in large part because of the family benefit. There is a huge family benefit burdened by employer in Sweden. But if you look at just the pension contribution rate, it's not that much. So the whole bottom line is that when you look at some numbers, there are some details, right? The devils are in the details. And especially Australia, right? So some people may say, Australia's social security contribution is only 11%. No, Terry probably knows it better than anyone else. It's a superannuation. So in Australia, it's based on tax system. They don't actually have a social security tax, right? So if you compare just numbers, you may end up with some misleading conclusion. So you should be a little bit careful just comparing the tax rate or social security contribution rate because it depends on system. It depends on system. It does not mean that actually the Australia's social welfare protection, the social protection is very low. It does not mean that. Actually, it means that they have a different system. Okay, I probably stop here. The last slide, probably. What the future holds in Asia. Taiwan, Japan, Korea, and Singapore and other countries too. So if you read the race to aging report by EC, European Commission, actually project their public pension spending. So they actually say it's set to increase and decline after 2040 due to reform, if the reform is implemented. Why? Because many countries adopted the automatic adjustment like Germany or Sweden, and they delayed in retirement. Every countries are doing this, and they lower coverage replacement ratio. I think it's very difficult, very different, and very difficult implementation because the speed of aging is very fast, and no automatic adjustment. So Korea is thinking about this one, but they haven't implemented it yet. Okay, it's like an NDC plan, and still have a very low coverage and low replacement. Even Japan has a very low replacement rate. Among pension replacement rate among all these countries. So, having said that, they need to focus on something else, right? Blind spots. Focus on blind spots instead of actually spending, their budget for everyone. Like focus on some poor elderly or delayed retirement, but of course the labor market flexibility issue. Or introduce automatic adjustment or even bundle scheme like Thailand. They started it this year. And pursuing healthy aging, that's actually Singapore's system. Singapore's primary is actually always a good system. And technology and community-based system is, I think it's Singapore, sorry. So someone mentioned this one. So I think that's, again, to summarize, the papers are great, but for future direction, we need to know and we need to see whether the country is heading to, what their plan is, relying more on work basis, pension system, pay-as-you-go system versus more saving-driven or family-driven. And some details like talking about the sustainability and effectiveness would be good. Thank you very much.
Thank you, Professor Lee, for your presentation, introducing your own framework. And I think it was an excellent idea to present your triangle framework visualizing evolution of the old age support system. Taking a look at the chatting window, I don't see any comments and questions coming up on my monitor. So why don't I start with my own question, not to the speakers, but to the discussants, Professor Lee. On your slide number 6, you put 2 arrows toward the US and Europe as the optional direction of movement for Thailand in the future. Well, after all, I would like to hear about your recommendation for the evolution path in Thailand. And what about Taiwan and Korea? Plausible direction of movement in your triangle of the support system. That is my question.
Okay. I think that's the question for the presenters. It's okay. So actually, Terry asked the question, but that's the question. There is no silver bullet. So every countries are different. Mm-hmm. So, probably you are asking about Korea.
Suppose you are in charge of everything. At the
in charge of everything for Korea, actually, I will focus on blind spots, definitely. So focused, rather than spending money for everybody, giving basic income, I will just focus on blind spots. The more efficient ways. For Thailand, I think they are actually moving to right direction. I had a very good discussion with the Minister Akon, and he was NESDC's actually head, right? So in the past, and he actually has a very good idea of whether the country is moving to. I don't know much about actually Taiwan because Taiwan is kind of, it's not very clear where they are actually heading to, but they are staying there. Singapore has a very good position because from the beginning, they put everything on family. Not everything. They put the burden on family and actually community and the individual actually forced to saving rather than government system. But anyway, I probably stop here because that's actually a very sensitive question too.
Thank you. I now have one question to be addressed to James. It's not about the aging, but it's about the fertility. One question that I have is about the importance of social values and lifestyles in raising fertility rate. James, on your slide number 11, you highlighted social values and lifestyles and emphasized that they are more important than the other 8 measures you proposed as the minister. Could you please explain a bit more about it?
Yes, I think your question is similar to the Professor Lee, the Taiwan, where is the position in the triangle. And, when came the administration 5 years ago, we emphasized the family value a lot and try to bring the family back in. And, I think that for the new generation, they delay their marriage or even no marriage. One of the problem is that because the higher education told them that the individualism and the family value is declined, and particularly under the DPP administration in the past 5 years. And I think you all know that Taiwan have the same-sex marriage, right? 3 years ago. And if you notice the statistics, the divorce of the same-sex marriage increased a lot, just in less than 2.5 years ago. So I think that this is a kind of challenge to the traditional family value. And if we want to boost our fertility, I think we have to bring the family back in. And also we have to emphasize the within family transfer. And that will be helpful to the increasing economic burden. And so I also like to suggest that the leader, the government leader, had to say something about the family value. Otherwise, the younger generation will just under the westernization, and then they are always interested in the consumption and individualism and Hinduism. So it's nothing to do with the family and the fertility. Thank you.
Thank you. We are a little bit behind the schedule, and Terry is supposed to leave this conference room in 5-10 minutes. So I would like to ask him to give any remarks or whatever he wants to say. He said he has 5 points to make. Terry?
Thank you very much. This has really been an exciting conference. I've been really stimulated by all the papers. But I have 5 points. There are 5 R's. The first one is retirement and the concept of retirement. I think we really have to get away from the old 1950s demography textbook, retirement age 60 plus, 65 plus, and using these different age cutoffs for retirement. Instead, we have data by single years of age. Why don't we start looking at labor force by single years of age? And when people retire, they retire. If they're not retired, then don't call them dependent. Even after dependence, though, after retirement, I should say, I have the second R is recreation, because all these older people, if you just listen to the papers, I think they're very unhappy. And when I go around the world, everywhere, I find that older people that I run into are quite happy. They're playing mahjong, they're carrying birds, they're doing exercises, they're dancing in the streets, they're doing all kinds of things. And we haven't said anything really very much about the recreation and health. A lot of older people spend a lot of their time trying to improve and preserve their health. And I think that all the older people who are in this Zoom meeting would actually probably like to stand up and go out and walk somewhere and do their recreation because they're missing it. The third thing is religion. Nobody's talked about religion, and yet as you go around Asia, one of the things that you find, and particularly in Thailand, I find that religion has an incredibly important role in many people's lives. I'm not talking about a single religion. I'm talking about notions of spirituality. Korea struck me as an amazingly religious place. As you're driving through towns, you're going past all kinds of different religious institutions. And I think we need to think about religion with regard to aging. The fourth point that I wanted to make is about residence. Often when we talk about retirement, it involves some movement away from the residence that people have had for much of their life. Sometimes it's because they've saved money and they move into a new and very comfortable residence. Sometimes it's because they go someplace that is more to their liking in terms of beaches or golf courses or whatever. But I think we need to be thinking a lot about aging and changing residence, not in terms of migration, but about what is it that people are looking for in their older age group. The next point, the next R, is robotics. I love all of these stories from Japan about having robots that provide care and support for elderly people, for people with mental problems, all kinds of things that can be said about robotics. Also about robotics and work, because we're getting away from the point where people are using pickaxes to dig a hole, and they're using machines and now increasingly robotic and AI interventions. And we haven't said anything about, what that's going to mean for the future. Finally, I'd like to just use the additional, this is now 6. The 6th R is risk-taking. I see 2 points of risk-taking. One is risk that we insure against. We haven't talked a lot about personal insurance. And I think that a lot of elderly people have insurance because that is one of the elements of their superannuation. But it's also a means of dealing with risk. The second aspect of risk-taking in Asia that just always stuns me is gambling. And we have a continent of gamblers. It is astounding to me, the amount of gambling. And I think that when we look at the elderly people, they're taking a lot of risks in gambling. Some are winning, some are losing, and some people are making money off of other people's gambling. So I think that these R's, if we keep our R's straight, we'll get much further in looking at aging in Asia. Thank you.
Thank you very much. You did your job and enjoy the rest of this evening. Well, I still do not see any comments. So why don't I just ask one question to Dr. Suzuki? And Dr. Shin, you are forgiven today. We are behind the schedule. So Dr. Suzuki, it was noted in your summary that the expansion of child care allowance and education has failed and has not been successful in recovering fertility rate. Could you please explain a bit more about this argument in 2-3 minutes?
So I think that I'm kind of skeptical about the effectiveness of pronatal policy because, for example, the fertility of the United States is relatively high in spite of the ignorance of family in the country. And so, in my view, all the advanced countries cannot reproduce its population. So I think lifestyle in today's advanced country cannot support population growth, cannot avoid population decline. So it's like nest of ant lion, as in the city in the pre-industrial era had a negative natural growth rate. All the cities needed immigrants to keep the population. So today, all the developed countries are like the nest of ant lions, need migrants to sustain its population. So I think in all the developed countries, pronatal policies are not very successful. Even France has below replacement fertility. This is my view.
Thank you. Well, listening to 6 presentations providing excellent reviews of demographic changes and policy responses in East Asia, I learned a lot today. It was a rewarding experience for me. Then I asked myself, what are the lessons we got for the future policies? Though these countries share a great deal of common factors in the direction of demographic changes, each country is different in its geopolitical and socioeconomic setting. These days, it is not that difficult for policymakers in one country to collect information on policy measures of other countries. So it seems that the policy responses have become similar to each other in many of the Asian countries. But there exists a time lag in the adoption of specific policies, as well as differences in the degree of main focus and priority. So we still have a lot to learn from good and bad experience of other countries. We need to stay connected and continue our good work together and further into the next step. Now, I would be very happy to invite volunteers who are willing to give some final remarks before closing this conference. Any policy implication we learned from this conference, any new findings, any concept or any causal link, or any suggestions for the next step of collaboration are welcome. Any volunteer? Stuart, are you there?
I am here.
Okay,
Hi.
go ahead.
Yeah, here we are. So, I think it was a very interesting meeting. I think that it's helpful for us in the region to learn more about the both the population dynamics, but I think more particularly and I think that's why what was good today is to really get down into the detail of this kind of social policy context and frameworks in different places. Because I think that as demographers, too often we say, we drop this shorthand of like low fertility is bad, right? Or aging is bad. Or there are too many young people or too many older people. And this is not right. It's unhelpful, right? This low fertility in and of itself is not a problem. It's just a thing that occurs. It's just a change, right? That societies go through. Low fertility only becomes a problem if the institutions which interact with low fertility, the institutions which interact with changing age structures, are not suited to that, and that there is a tension there. And I think that we've got to start. I agree with what Terry was talking about earlier, that, all this language of dependency, this language of 65, this language of, cajoling young people into having more children that they don't want to have because the circumstances are not right for them, in order to fix a social insurance system or a pension system, is, I think, back to front. And that's why I think what we've done today is so valuable, is really understanding both sides of the equation, right? That it is that link between both demographic change and the social context. And I think that just if you look at the title of the conference today, so it's population change and policy response. Well, don't forget, it's policy that causes population change as well, right? So if we have better policies in place, maybe that are more supportive of people, and particularly of younger people, to live out their aspirations, then I think we would have maybe possibly a bit less of the challenges that we've been identified today.
Thank you, Stuart. Any other volunteer?
Can I
Yes,
say a
go
few
ahead.
words?
Yes, James.
Okay, I just mentioned that it seems to me to keep everything balanced, we need to bring the family back in. To be specific, I mean, we need the young people to learn to take responsibility of other people in the family, or to care the other people in the family, because we are the human beings. Okay, I think this is a very basic ideology for the human beings. So I don't want to see too much of the individualism, because it won't be the basic human beings. That's my point. Thank you.
Thank you. Any other remarks? Then
Can I say something?
Yes, please.
Yeah, just a short one. I'm an anthropologist by training, so I'm actually really interested in how on the ground, how are things being, how do people react? So if you are looking at, for example, if community-based is something that moving forward, we're going to see more of it, and what have each country been doing? What are some of the best practice or lessons to learn from the groundwork? I think it will be interesting if we can, do some comparisons across countries on that as well. Just moving forward, some just wild thoughts. Thank you.
I just hope that we will have another opportunity to meet with each other not too far in the future. Before closing this session, do we have any announcement or nothing? No? Okay. Then On behalf of the KIHASA and the organizer of this conference, I would like to thank once again 7 speakers, 2 discussants, and all the participants for your participation and contribution. And I think we owe a debt of gratitude to Dr. Yoon Jung-shin and all the staff members in KIHASA and in this studio who have made today's conference possible. Why don't you give them a big hand? Thank you indeed.